We good? All right, we're going to go ahead and call the first interim meeting for the Legislative Budget Committee to order. First, we're going to have on the first item on the agenda is the impacts of the One Big Beautiful Bill Act that was passed by Congress and signed by the President. And so I would ask that Dylan Deere, the Assistant Director of Fiscal Affairs with the Kansas Legislative Research Department, to give an update on the One Big Beautiful Bill Act and how that may impact the state of Kansas. Dylan.
Good morning, Mr. Chairman, members of the committee. Welcome back to the State House. So you should have a 25-page memorandum that's in front of you that will have some details on the impacts of not just the One Big Beautiful Bill Act, but also the Rescission Act of 2025. And we also include some sections in here on specific DOJ, like deletions as well. Those DOJ items in particular are very difficult to track because they're not enacted into law in most cases. And so we just try to identify those ones that we have been able to confirm. And I'll go over that as we go through it. One other item I'd like to mention is that this is going to be kind of like the ARPA memo. It'll be a work in progress. So we will continue to update and put out new revisions on this memorandum as we get more information and more details on the specific impacts. I would like to acknowledge that the analysis found in the Kansas impact section is prepared by KLRD. State agencies provided information to us. However, the interpretations and conclusions are those of KLRD and do not necessarily represent the views of those agencies. But we have spoken with all the agencies on all the items that are in here, so there's been open communication. I would also finally like to acknowledge the work of the fiscal team. They've done a lot of hard work. In particular, Ariana Waddell has done a lot of really good work putting this memorandum together, and I just want to acknowledge the work that's been done there. And with that, I'm going to move to the bottom of page 1. So the way this is organized is we're going to go through the various OBBBA provisions. Okay, and then it'll have a bold section underneath it that'll have Kansas impact, and we'll talk about whether there is or is not a Kansas impact. The first is under food nutrition programs, under SNAP. This provision prohibits the Secretary of Agriculture from increasing the TFP through market-based reevaluations or updates, and instead requires that they use CPIU. Turning to page 2, the Kansas impact. This provision limits future updates to the TFP to changes in inflation as measured by CPIU. As a result of this change, the U.S. Department of Agriculture may no longer adjust the TFP to reflect improved nutrition science, evolving food choices, or updating dietary data. Consequently, SNAP benefits received by Kansas households may lag behind actual food costs over time. Obviously, that's the language from the agency. Under SNAP, amending ABOD work requirements, the Kansas impact on this one, this provision will expand the number of Kansas SNAP recipients subject to work requirements by increasing the upper age limit from 54 to 64. It will also reduce the number of individuals exempt due to caregiving responsibilities by lowering the dependent child care age to 14. Under SNAP, changing eligibility for standard utility allowances. This provision will only include households that includes elderly or disabled members can qualify for the SUA or the standard utility allowance. The Kansas impact. This provision means that currently eligible Kansas households receiving minimal energy assistance will no longer automatically qualify for SUA unless they have an elderly or disabled member. Turning to page 3. SNAP, adding restrictions on internet expenses. This provision actually aligns with current law, no impacts here. Under SNAP, establishing state cost-sharing requirements beginning in federal fiscal year 2028, and I would remind the committee that the federal fiscal year begins in September. The state share of SNAP benefit cost share will be based on the state's SNAP payment error rate, which includes the following cost-sharing structure, and you can see if you're less than 6%, it's 100% cost share, and if you're 10% or greater, it's an 85% cost share, thereby increasing the amount of the state cost share of the administrative costs. The Kansas tax error rate is about 9.47%. So under this, that would Kansas would have been required to contribute 10% state match under the proposed framework, equivalent to approximately $40.8 million per year underneath this provision. Once again, that does not kick in until federal fiscal year 2028. SNAP, providing administrative cost sharing. So the OBBA increases the state share of SNAP administrative costs from 50% to 75% beginning in federal fiscal year 2027. The Kansas impact on page 4. This provision changes the state's share of SNAP administrative costs during the COVID-19 pandemic. Administrative costs were reimbursed with 100% federal funds through ARPA. With the new requirement, Kansas is estimated to incur approximately $19.7 million in additional annual costs underneath the new requirement. SNAP, expiring the SNAP Ed program. The OBA includes language to expire the SNAP Ed program, which is a federal grant program that provides nutrition education and obesity prevention among SNAP eligible individuals. The Kansas impact, this provision may impact the continuation of SNAP Ed activities in Kansas beyond federal fiscal year 2025. In Kansas, SNAP Ed is implemented by Kansas State University, ESARP, in partnership with DCF. Kansas receives a SNAP Ed grant of approximately $2.8 million. Under SNAP, changing eligibility requirements. This provision narrows SNAP eligibility. Kansas currently allows federal SNAP eligibility guidelines. Under the enacted provision, certain groups that are currently eligible would become ineligible. These groups include refugees, asylees, trafficking and domestic violence survivors, humanitarian parolees, and individuals with undocumented or temporary visa status. Turning to page 5. TFAP, extending mandatory funding. This provision maintains federal support for food recovery distribution initiatives. With this, I would move to the healthcare programs. So if you look at Medicare, Medicaid, Children's, or CHIP, prohibiting implementation of eligibility rules. Section 17011, this section prohibits enforcement of specific regulatory changes affecting the MSP or Medicare Savings Program. It also appropriates $1 million to the CMS administrator in federal fiscal year 26 to carry out these provisions. Section 71102, this section prohibits the enforcement of specific changes affecting Medicaid and the CHIP program and basic health program. The Kansas impact, this will have minimal impact on the state of Kansas due to our current guidelines. If you look to the bottom, Medicaid CHIP requiring address verification. Kansas impact, this provision may increase some administrative costs as states are not currently required to proactively update enrollee contact information. Preventing duplicate enrollment, you may have an increase in administrative costs under death, master file checks for enrollees and providers. Again, a slight administrative cost increase. Under Medicaid, recouping federal funds for erroneous payments. The OBBA narrows the scope of potential waivers of payment reductions related to certain erroneous or excess payments. The Kansas impact, this provision may increase the amount of federal funds being recouped by CMS. This provision requires HHS to reduce federal financial participation to states for identified improper payment errors related to payments made for ineligible individuals and overpayments made for eligible individuals. If you look at Medicaid, increasing the frequency of eligibility determinations for the expansion population, this is no impact. This would be an expansion state only provision. If you look at Medicaid revised home equity long-term care services, no impact. If you look at Medicaid amended definition of qualified alien, going on to page 7, no impact. No impact. If you look at Medicaid CHIP limiting retroactive coverage in the middle of page 7, the OBBA limits retroactive Medicaid coverage to 1 month of expansion enrollees and 2 months for traditional enrollees in CHIP. This provision may have minimal savings for the state as current policy allows 90 days of retroactive coverage. So prohibiting funds to certain abortion providers, no impact. Sunsets the FMAP for expansion states, no impact as a non-expansion state. Implementing moratorium on provider taxes. The OBBA implements a moratorium on new or increased provider taxes, thus holding the threshold at 0.0% for new taxes. However, this provision is not anticipated to impact the current hospital provider assessments charged in the state of Kansas. Restricting provider taxes for expansion states, that's not going to have an impact as a non-expansion state. Turning to page 8. Revising the payment limit for state-directed payments. This provision may reduce the amount of federal funding provided for state-directed payments. For Medicaid, modifying waiver of uniform tax requirement for provider taxes. That is not anticipated to have an impact. If you look at the very bottom, Medicaid adjusting coverage criteria for HCBS waivers. So the OBBA allows states to create a 1915C HCBS waiver for individuals who do not require institutional level care with $100 million allocated in federal fiscal year 2027. This provision creates an opportunity for federal funding to increase HCBS access in the state of Kansas. And so there's some federal funding allocated for that purpose. If you turn to page 9, ACA exchanges, no impact. Medicaid CHIP, establishing the Rural Health Transformation Program. So the OBBA establishes a Rural Health Transformation Program that provides $50 billion in formula grants to states, $10 billion annually from federal fiscal year 2026 to 2030. States are required to submit a transformation plan to access the federal funds. For the Kansas impact, this provision may make additional funding available to KDADs through grants and formula funding, including support for opioid treatment and rural behavioral health services. So this is a new federal funding stream that's opening up there. And I'll stop there for just a moment before I move on to agriculture and conservation. All right. I realize this is pretty dense. The bill had a lot of different effects, and we're just trying to make you aware of all the things that are changing. So under agriculture and conservation, if you look at the urban and community forestry program, this is a rescinding of unobligated balances. This provision's impact on Kansas depends on how much the state's share was already obligated. We're still looking into that with the Kansas Forest Service. The agricultural conservation easement program, the modifying of funding. The OBBA increases mandatory funding for agricultural or ASAP easement program from $450 million annually through 2031 to the following levels, and you can see it increases it to $625 and $650 and $675 and then $700 going through 2031. Turning to page 10. And this provision may expand federal grant opportunities for eligible Kansas entities, including land trusts and local governments, to apply for ASAP grants. If you look at the Environmental Quality Incentives Program, there's a modification of funding. This is an increase in funding. This provision may expand federal funding in Kansas for the EQIP, which provides financial and technical assistance to agricultural producers, landowners, and operators of eligible lands to improve soil and water quality. If you look at Conservation Stewardship Program modifying funding, the OBBA increases mandatory funding for the stewardship program. Once again, this is probably a new opportunity for a new funding stream. If you look at the Regional Conservation Partnership Program modifying funding, the OBBA increases mandatory funding for the Regional Conservation Program from $300 million through federal fiscal year 2031 to the following levels. So 26 is 425 and then 450. Turning to page 11, Kansas impact. Once again, an increase in federal funding. This specifically supports agricultural producers, tribes, and partners in implementing watershed-scale projects that address resource challenges and improve water quality and soil and wildlife habitat quality. If you look at the Voluntary Public Access and Habitat Incentive Program, it appropriates $70 million. The Kansas impact, it may assist Kansas maintaining or expanding public access programs. So the potential impact of this provision will be explored by the Kansas Department of Wildlife and Parks. If you look at the Watershed Protection and Flood Prevention Program modifying funding, so the OBBA increases mandatory funding for the Watershed and Flood Prevention Program from $50 million to $150 million annually. This provision may increase opportunities for Kansas to improve water infrastructure and address regional conservation and flood mitigation issues. If you look at the Plant, Pest, and Disease Management and Disaster Prevention Program, there's a modification of funding from $75 million to $90 million annually. Again, an opportunity for a new funding stream, specifically dealing with the spread of harmful pests. If you look at the Specialty Crop Block Grant Program, it increases mandatory funding for the Specialty Crop Block Grant Program from $85 million to $100 million annually, beginning in federal fiscal year 2026. And so there's going to be some additional funding for Kansas specialty crop projects. KDA has previously awarded these funds to manage projects for marketing, education, research, and infrastructure. If you look at page 12, Organic Certification Cost Share Program. This provision may help maintain access to cost share assistance and organic producers and handlers in Kansas. It sets mandatory funding at $8 million and increases the reimbursement rates. If you look at animal disease prevention and management modifying funding, the OBBA increases mandatory funding for animal disease prevention and management from $30 million annually to $233 million annually for federal fiscal year 2026 through 2030 and $75 million annually thereafter. So the provision may increase federal support for animal disease prevention efforts in Kansas, and the potential impact of this provision may require further review by relevant state agencies, Kansas Department of Agriculture being the obvious one. With that, I would move to energy and climate. And just if you have any questions, just stop me at any point. So green and resilient retrofit program. I'm going to go over these pretty quickly. What you have here is a rescinding of unobligated balances. The provision may affect access to the GRRP, or Green and Resilient Retrofit Program. The way that's been spent in the past is there's a $750,000 elements grant to the American Community Developers for Green Park Apartments in Junction City, an $8.8 million leading edge loan to Gateway Plaza in Kansas City, and a $4.4 million comprehensive grant for Edwardsville Court. But this is only unobligated balances. So if that money's already been obligated, then it would not affect those projects. There is additional appropriation of funds of about $12 billion starting in federal fiscal year 25 for air traffic control investments. This provision would provide Department of Transportation, Kansas Department of Transportation, and FAA funds for state air traffic control infrastructure and radar systems. Moving to page 13. So the first two are rescinding of unobligated balances, but it looks like Kansas would not be affected. Under Gulf of Mexico Energy Security Act modifying funding, under current law, qualified revenues from offshore oil and gas leases are distributed among Gulf states and their subdivisions, 37.5%. This provision may increase funding for land and water conservation funds, which are received by the Department of Wildlife and Parks. All right. So if you look at the state-based energy training grants, rescinding unobligated balances, the Kansas impact, the provision may affect funding for the Training for Residential Energy Contractors Program, which is managed through the Kansas Corporation Commission. Yep, pass over that. Tribal Energy Loan Program. These are all, everything on page 14 is rescinding of unobligated balances, so there will not be an impact. Everything on page 15 is rescinding of unobligated impacts. And only if there's unobligated balances in any of these cases would you have an impact on any of these. On page 16, no major impacts. On page 17, no major impacts, except, so if you look at climate, in the middle of page 17, climate pollution reduction grants, rescinding of unobligated balances. Kansas was awarded a $3 million planning grant through KDHE. Additionally, the Iowa Tribe of Kansas and Nebraska and the Prairie Band Potawatomi Nation also received awards. And so we're further reviewing how that may impact those planning grants. If you look at the bottom under environmental and climate justice block grants, this rescinds unobligated balances. So this provision resulted in the termination of an environmental justice government to government, or EJG2G grant awarded to KDHE. They were awarded $1 million to implement environmental and public health strategies under resilience and sustainable food systems in the Cherokee, Labette, and Montgomery counties. So if you look at the low carbon transportation materials grant program in the middle of page 18, it does rescind unobligated balances. So this provision's impact on Kansas depends on the amount of the state share that was already obligated. In November of 2024, KDOT had awarded $31.9 million underneath this program to modernize practices and focus on using materials like cement, concrete, and asphalt that have lower levels of human-generated gas emissions. And so we're still working with the KDOT to determine how much of that total amount had been obligated at this time. Under immigration and public safety, the first under state border security enforcement, as a non-border state, there's no impact. Under state homeland security grant program, the OBBA appropriates $500 million effective through federal fiscal year 2029 under a new state homeland security grant program. This provision increases DHS and the Federal Emergency Management Authority grants to Kansas for UAS monitoring, unmanned aerial systems. Under State Homeland Security Grant 2026 World Cup, which is the second item on page 19, the OBBA grants $625 million effective through federal fiscal year 2029 for security costs. And this provision may provide additional federal funding to Kansas to support security activities. While the majority of these funds are expected to support security efforts in the official World Cup host cities, Kansas may receive some federal grants funding to support related security activities. I know there's been a lot of conversation about that. And then there's no direct impact on the second one. Under Operation Stone Garden, the OBBA appropriates $450 million effective through federal fiscal year 2029 for this program. It provides funding to enhance cooperation and coordination among state, local, tribal, and territorial and federal law enforcement authorities to jointly enhance security along the United States land and water borders. There may be some pass-through funding here. So if you look at the bottom of page 20, state and local law enforcement assistance appropriating funds, the OBBA appropriates $3.3 billion to the U.S. Department of Justice effective through federal fiscal year 2029, and these are going to JAG and COPS, or Community-Oriented Policing Services grants. So we report, whenever we do the Office of the Governor's budget, we'll report on those JAG grants and COPS grants. So this just increases the amount of federal funding available for those grants. Looking at page 21. No impacts on this. So if we look at the Rescissions Act of 2025, the Rescissions Act of 2025 rescinds $9.4 billion in unobligated funds from several agencies such as USAID, and you can see those rescissions on the bottom of page 21. The Kansas impact is on page 22. So KSU administers USAID grants, including the Climate Resilient Sustainable Intensification Innovation Lab, or CRISL. And this cooperative agreement, valued at approximately $50 million over 5 years, focuses on climate resilient agriculture in Feed the Future target countries. There's a reduction of funding for the Corporation for Public Broadcasting. Federal funding was terminated, rescinds $1.1 billion in appropriations. The Kansas impact. In federal fiscal year 2024, Kansas public media stations were awarded approximately $4 million in CPB community service grants, including $3 million in television community service grants, about $1 million in radio community service grants, and $43,000 in system service support grants. Other federal funding changes that we're aware of, there's about a $37.9 million estimated cut in health and mental health grants that we're still exploring the effects of on page 23. Specifically, those reductions, according to KDHE, 4 CDC-administered grants were terminated effective March 24th, 2025. As a result, KDHE reported the elimination of 56 full-time equivalent positions, including 29 in immunization, 11 in laboratory, 8 in epidemiology, 7 in local public health, and 1 in administration. There's some additional reductions in immunization and vaccines for children, $15 million, $6.1 million reduction in COVID-19 health disparities initiatives, $7.9 million estimated reduction in epidemiology and laboratory capacity, and some other smaller. There's a $6.5 million estimated reduction in mental health block grants, and about a $2.1 million estimated reduction in substance abuse block grants. On page 24, there's about an $8.23 million estimated cut for the digital equity grant. That had been originally awarded $8.2 million to the U.S. Department of Commerce. The grant was designed to support digital inclusion efforts in Kansas with a focus on broadband adoption, digital skills development, and device distribution. There's a $1.1 million reduction to the UI Insurance Integrity and Fraud Prevention grant. And the BRIC program, which we should all be familiar with from Build Kansas. In Kansas, there's been 14 projects submitted to the Build Kansas program. The cancellation applies to both pending applications and awards not yet obligated. So anything that's not yet obligated would be impacted. And the last thing I will mention on the bottom of page 25 is Grain Belt Express. So the Department of Energy terminated a conditional commitment for a loan guarantee with Grainbelt Express LLC, which was for up to $4.9 billion for Phase 1 of the Grainbelt Express transmission project. And I believe there was a hearing on the Grainbelt Express during regular LBC last session. And that, I apologize for the volume, but that is the memo, if anyone has any questions.
All right, thank you, Dylan. So the total impact to the state of Kansas, what is the dollar amount?
We
Do you
don't
have
have
that?
an exact dollar amount. What we pretty much have is itemized items. If you'd like me to put together a spreadsheet for each thing that we know for a fact, we can. But it's going to be really difficult to do because a lot of these are grant opportunities is what we're looking at. So we're looking at either additional federal funding streams being made available, but we're not going to know how much Kansas is going to receive, okay, or a rescinding of unobligated balances, but we are still working with the agencies to determine what specifically has and has not been obligated.
All right, thank you. And so going to page 11, the $75 million annually to $90 million annually for plant, pest, and disease management. And so the Kansas impact would be preventing the introduction and spread of harmful pests. What would that be considered under?
I'm sorry, what would be considered?
What is a harmful pest?
I think they're
the
talking
definition.
about crop species.
Okay.
Yeah.
That's what I was kind of wondering. My next question. So we've been having, for the last couple of years, a discussion on, it'd be on page 19. And in regards to the World Cup, and actually we're going to be having an update from the World Cup later on this morning. And so the federal government is going to be providing federal funding for security, and that was the money that the state allocated was in regards to security and transportation. And so I'm just kind of wondering exactly how much is going to be allocated. You said $625 million. So for the World Cup event that's coming to Kansas City, how much is going to be allocated for that particular region?
So we have not heard yet, but I know that the World Cup organizer is here, and she might have some more information for you at that time. We just know what the total federal funding nationwide is at this point. So we're waiting to find out how much Kansas may receive as part of that.
Because I believe we've allocated over $30 million in the last in 23 and 24 in the fiscal years for the World Cup, and the main reason was for security. So I was just kind of wondering exactly how much the federal government is going to be providing for the Kansas City area for that particular event. Going back to page 18 on the state border security enforcement, it says that, in 24 we appropriated $15.7 million to assist Texas. Didn't that money lapse back to SGF?
It did.
Okay, I was just making sure that we had that on note. I believe that's all the questions that I currently have. So it seems like a lot of the items in regards to the one big beautiful bill, and then also with the precision, is in regards to unencumbered funds that were supposed to be utilized and they were not. And so the federal government is pulling those dollars back. Is that correct?
So the overwhelming amount of the reductions are in rescissions of unobligated balances. The one area I would say is a little bit different is some of the SNAP effects, particularly with SNAP error rates. And so there may be some substantial increases in administrative costs and local state cost sharing if we continue to have high error rates inside of DCF for SNAP distribution.
All right, thank you. Any questions for Dylan? Senator Petty.
Thank you, Mr. Chairman. So back to that SNAP. So I made a note here, $40.8 million increase per year.
So
That
that's
was page
what
3.
it would be under our current error rate. So under the 9.7% effect, and so because this does not, I would note that this does not kick in until federal fiscal year 2029, I believe, and so 28. So assuming that we continue to have the 9.9% error rate, 9.98% error rate, then it would have a $40.8 million impact. That's correct.
But when it comes to that error rate, I'm trying to remember, I saw these stats that's about average, isn't it, for
Honestly, it is.
Yeah.
There are a lot of states out there that have much higher error rates than the state of Kansas, and there's only a very small number that have lower error rates, substantially lower error rates, and that sort of that less than 6%. I would also note that an error does not necessarily mean an incorrect payment. So if there is an error in the address, if there's an error in the name, if there's an error in a telephone number or contact information, all those are errors. So every error is not a wrong payment. I just want to make that clear.
And I didn't quite understand, Mr. Chairman, can I continue?
That's fine, yes.
Under the amending the thrifty food plan adjustment, going from how that's calculated now to the CPIU. So do we have an estimate of how that impacts our?
What we do know is that the cost of food has outstripped the CPIU rate substantially. So instead of using effectively what is a basket of goods, of food services only in order to be able to adjust that, you use the overall CPIU rate, which includes non-food items. And so definitely over the last 10 years, that would end up, the food, food costs would outstrip it. But we don't know if that's going to stay the same. Because, before the most recent run-up in food prices, actually food prices had been very stable for a long period of time. So prior to that, the CPIU would have given a higher level of increase. And so it's hard to predict what will continue to occur in the future. But they have moved at different rates over time.
So, Mr. Chairman, along with your request, I would really like to see, because there are a lot of impacts here on SNAP, whether reduction, well, as the 40.8 million increase per year, but and then the changes in the work requirements as well, going from 18 to 14 to required dependent. So I would like to see that just a potential impact with those multiple changes for SNAP and the year that it takes place. Thank you.
Mr. Chairman, that'll be fine. Like I said, this is very much a work in progress. We're continuing to track the effects of these various provisions, and we can update you on that.
All right, thank you. Senator Billinger.
Thank you, Mr. Chairman. Thank you, Donald. Back on that error rate, I mean, why would we have errors on addresses, name spelling, things like that? I mean, isn't there an application they fill out?
There is an application that's filled out.
Are we
and
dropping
when you go
the
back
ball?
and double check it, you just find small sort of data entry errors in that. I know that DCF is aware of the issue, and they say they are addressing it.
So another question on that same line is, do we know how many ineligible people are receiving SNAP or whatever else?
I have that number. I wouldn't want to say it off the top of my head. I know that the number of ineligible recipients is quite low annually, but I'll get you that exact number. Once again, I mean, you get this 10% error rate, and people think that means 10% incorrect payments. That's not what that means at all. I think it's under 1%. I'm getting a shake head, so I'm going to hold off on saying that.
So do we have a chance by lowering this to have less of a cost? This 40 million goes down
I mean, if the error rate goes down,
Right.
then the amount of the state cost share, will go down. Okay, so what's happening here is that effectively the state is getting a cost share percentage, when we did not formally have one, because of the error rate. So if the error rate pulls down, then we will decrease that possible future cost.
All right, so not to interject, Senator Billinger, but I have a question in regards to some of the items in regards to states that had expanded Medicaid. And obviously, the state of Kansas has not, and so there was the notation that it would not have an impact on the state of Kansas. Had the state of Kansas expanded Medicaid, what would the impact have been?
Well, it'll be
we
listed
know?
in each one of those impacts. I mean, there's about 10 bullets in here that are specific to expansion states. And then you would have had those various effects that are labeled in the OBP.
But we don't have any definitive dollar amount of how much that would impact the state had
We didn't do
had
that calculation.
passed it in the past.
We haven't done that calculation, no. And it
I'd
would
kind of like to
verify-
see what the impact would have been, because obviously there's been a push and a dialogue out there on Medicaid expansion, and I was kind of wondering in 2028, what the impact would have been for the state of Kansas if we would have passed a Medicaid expansion.
We'll work on it.
All right, thank you. Senator Billinger, do you have more questions?
I had one more on the waivers for the home and community-based services. Is that 100 million just for Kansas?
No, it's not. This is
Okay.
going to be a nation, this is not Kansas specific, it's nationwide.
So any idea what we might get for an increase?
It all depends on applications.
Okay, thank you.
So I guess what I would say is, it is our intention that as the legislature begins to review these various agency budgets, we will make these provisions available to those committees, and so they can inquire at that time as to how agencies are proceeding on those applications.
So it looked to me like there's a lot of added stuff also.
Particularly in the areas of agriculture, absolutely, there's quite a few ads.
Thank you.
And we'll have that discussion when Senator Billinger decides to have our first meeting for the expanded Legislative Budget Committee. Representative Williams.
Thank you, Mr. Chair. So a couple questions. First of all, this pretty much highlights the importance for our legislative budget committees to understand the breadth and the depth of all of the federal programs. And I know we've talked about that, and there's been a request that you have presented to the Department of Administration to disclose all of the programs, all the federal programs from every agency. Did we get a timeline of when the Department of Administration was going to provide that information by agency?
So we have received the majority of that information at this time, and we are collating it and putting it together into an integrated spreadsheet. I think there's only one agency that's still outstanding that we are still waiting on information from.
Okay, so that information will be based on, all the different budgets, all the different agencies. We can look and say, okay, DCF has 200 different federal programs. Here's how much they spend on it. My other question related to that is a lot of times they require a match. Some of those matches are mentioned in here. Some of them aren't necessarily mentioned. But then oftentimes beyond a match, there's still an administrative cost. There's employees that we maintain. There's the, actual the space that they take up, that cost and so forth. So if there's any way to get an idea of what the additional impact is beyond just the match when we're looking at these federal programs. And then my last question is, throughout here, there are examples of increases in funding. Well, World Cup is just one of those increases. Would we be able to, I guess it may be very specific to each one, and maybe you'll be able to help us identify those, offset those federal increases. So, for example, when we put 30 million in, we can offset that. Or, for example, in the JAG program that was mentioned on page 20, or will we be able to offset those, or does it require an increase in those particular programs?
Well, so in many of those cases, there is no state funding in that particular area. I mean, you could, I guess, cut, like if you're talking about like JAG and you're talking about monies that are going out to local law enforcement, would you want to make reductions in state grants to Kansas Highway Patrol or something like that? And I'm not suggesting that in any way, shape, or form. Don't want to sound like that. I'm just trying to understand what
So
you're
the question would
suggesting.
be more related to any of those programs where there is state participation in those programs. So if there's a 25% match, or in the case of the World Cup, when we have already allocated $30 million, I thought it was 28, but $30 million. And so could we take some of those monies and just offset our expenditures, since we have already obligated ourselves? We did not know that that money was coming, so now can we take that money and drop it into state general fund? Or any other program in which we've already allocated resources and we feel it's at an optimum level, could we then supplant?
So there will definitely be opportunities for that. Now, you would not take that money in any case and put it into the state general fund dollars, because that would be an inappropriate diversion. But there are a variety of cases in which you may be able to reduce the state spend in those cases.
Okay, thank you.
Senator Petty, did you have a follow-up question?
Maybe you can come back to me. I got sidetracked.
Representative Ballard.
Thank you, Mr. Chair. On page 8, I'm looking at the Medicaid adjusting coverage criteria, HBS waivers. The Kansas impact was that we could create an opportunity for federal funding to increase access. What do they mean by that?
Dylan?
Yeah, so this is going to be a new program. It's specifically going to create this waiver under the 1915C, okay, specifically for individuals who do not require institutional level care. So it's trying to segregate that HCBS population. And it's providing $100 million annually, but that's, of course, nationwide. And so it's just a matter of whether or not, I believe KDHE in this particular case would be applying for this new program or not.
Oh, okay, that was my next question. Isn't it automatic, or do we have to apply for the 1915?
I'm looking at Megan, and she does not know, but we'll find out.
Okay, that was my question. The other one is on 9, where we're talking about the Medicaid CHIP establishing the Rural Health Transformation Program. I'm looking at the Kansas impact for opioid treatment and rural. Is this to benefit rural hospitals or just in general?
It's specific to rural.
But does it mean they're hospitals or just services available in that area?
I don't know. I'd have to look into this. And then honestly, a lot of these things, if you look at the bill, there's not a lot of detail.
Okay.
And so we're not going to really know the effects until the regulations get adopted that specify how the money has to go out.
Okay.
But I'll see if there's been any regulations in this area yet.
Thank you. Thank you, Madam Chair.
So going on Representative Ballard's comment in regards to the opioid money, obviously we had the settlement money that's with the Attorney General, and that has, I guess in a way, specific parameters around that. So is this money more lucid?
Yes. This money should be more flexible. It all depends on how those regulations are adopted and how they define this rural health transformation program.
So in the past, we have had some additions to the budget in regards to how to spend the opioid settlement money, and that has been vetoed by the governor. Due to the fact how it was set up when the legislature created that settlement fund. And so if we would use these funds for those particular items, that would be legitimate?
I cannot say that until we see the regulations that are adopted under this rural health transformation program.
Okay, well,
So I know that there's language inside the bill that specifies opioid abuse, and that's why we put that in there. But exactly how those monies are going to flow out, who they have to get targeted to, whether they have to go to a hospital or more of a rural health clinic, all that's going to depend upon the actual regulations that are adopted.
All right, thank you. And believe me, I'll ask that question later when session starts.
Right.
Senator Petty.
I just wanted to ask, Mr. Chairman, since you asked for the particular items that dealt with states that had expanded Medicaid, that as that's being, well, you know, that's going to be difficult, but as that's being put together with those items that specifically impact that it would also include how much we have lost since we have not expanded Medicaid, because we would have receiving millions of dollars more every year if we had passed Medicaid exemption. So I think it's important to have that balance there. Thank you.
We can provide that information.
All right, one final question, then we'll move on to the next item on the agenda. So in regards to the BRIC grant that was rescinded through FEMA, we have 14 projects that were submitted and approved initially by the federal government, and now they've been rescinded.
That's correct.
And one of those happens to be my hometown. So I'm going to ask this. Even though they were awarded, if they've started, they're still being rescinded?
The cancellation applies to both pending applications and awards not yet obligated. So if you've actually begun the project and obligated the funds, signed contracts, then no. Okay, but if you've made the award but you haven't actually signed the contracts, then yes. So it's more restrictive than the ones that are just rescinding of unobligated funds. Okay, because because it applies to pending applications.
So because I know that in the city of Russell, it was for electrical upgrades. And I believe they already started. I have a meeting with the city manager on Thursday. So I'm going to ask her about that. But it is my knowledge that it was already started. And so having them listed, I was just kind of confused. My next question is, so of these 14 projects that have been rescinded, what is the obligation that we are making out of the Build Kansas Fund coming back? What is the dollar amount?
We'll find out for you.
All right. I don't see Charday in here, but, oh, no, there she is, right there. So we'll have that for the next Build Kansas meeting when Senator Bellinger decides to have one.
So actually, I think it says on page 25, the projects requested combined $174 million with state restoring $51.9 million in matching funds.
Okay, 51.9 million?
0.9. But I believe that is assuming that all of these projects are suspended, and I think if the contracts have already been signed, then that is an obligation, and that project will continue to go forward. It's only if there's an application, but no contract.
Okay. Because I know that for the city of Russell, I keep referring back to that because, like I said, that's my hometown, but that was like one of the first projects that was approved. And so I'm under the assumption that it was already started. But, all right, thank you, Dylan, and thank you for the update on the state impacts for the One Big Beautiful Bill Act and also the rescission bill. We're going to go ahead and move on to the federal clawback of Medicaid funds to K through 12 school districts. And so I believe first up that we have is Secretary Janet Stanek from the Kansas Department of Health and Environment. Welcome, Madam Secretary.
Good morning, Chairman. Thank you, and members of the committee. Christine Osterland, our Medicaid director, is not here, but I've been working alongside her, and I have a couple of representatives from our fiscal team and Medicaid to help if I run into any issues explaining this complex matter. The good news is we're on a path forward, and we have broken down your document. I hope you have the testimony in front of you into, I hope, easy to read sections on the story of school-based services billing. So I want to start with saying that they're billed, school-based services are billed through two different mechanisms. One is called the claims reimbursement, where the providers bill for services, and the other is administrative claiming, where the schools are reimbursed for the cost of providing school services, and this is where an error was made. So I will start out by saying this was an error that was discovered. So in the incident where we discovered the error, Gainwell, who's our fiscal intermediary, you've heard of them, they basically calculate every year with our consulting group, PCG, to identify the individualized education program, or IEP ratios. And during the fiscal year, we're always in a look-back period for fiscal year 23. Several school districts flagged that they thought there was potential error in their calculation. So fast forward, after they raised concerns, Gainwell reran data and discovered there indeed was an error in the ratio numbers for the IEP. This was the typo made on the data request had to do with the numerator. It asked for a student count based on billed claims instead of a count based on paid claims. And so if you work in this arena, you know that makes a big difference. So basically, I would say that this area, no excuses because we're working on a path forward, but it is under-resourced in the management of this program. It was cut back under the one or two previous administrations. Staff were cut. We've also had turnover in the schools. The people that manage these programs in the school turnover. They're normally at clerical level that are submitting the information, et cetera. And PCG, our consulting service, has had turnover. So perfect storm type of stuff. Basically, we had to go back, and Medicaid was required to do a look-back period of 7 years because we discovered that this error had occurred, and that is what Medicaid requires. So we did find out that all 7 years had the same error because the wrong numerator and denominator were being used. So the total recoupment for that period is $11,210,060. The total dispersed to those school districts over that time period was $235 million. So the recoupment was 4.4 million, or excuse me, 4.4% of that total amount. A large majority, 153 of the districts, which is 70% that were impacted, have a recoupment of less than $25,000. Wichita Public Schools has the largest with 3 million plus, and last year their annual cost settlement was 5 million, just to give you a comparison. So on page 2, we describe the recoupment process and what we're doing. And again, for the sake of time, I don't want to read every line, but there is a process that's outlined. And basically, for those that had $50,000, we could withhold their recoupment from the June payment, which many of them did. And then we offset the recoupment through payments they were owed over the next 4 quarters because CMS requires us to have this payback done in 1 year. We don't have a choice. So the schools have been great to work with, as well as the Department of Education, and we worked out plans for all of them, and we are on a path forward to recoup the money and get this back to CMS and get back on a solid footing. On page 3, I wanted to talk about some of the efforts and support we're doing for error resolution. We've committed a bunch of senior level resources to review the updated analysis in the prior period adjustment and the claims for October through December of '24. We've got some additional resources to facilitate the expedited collection of the forms and cost settlements with prior period adjustments, multiple one-on-one calls with school districts, and to address questions regarding the prior period adjustment. I myself participated in and led a WebEx with our team early on when this happened to answer a lot of questions, and then we did a frequently asked questions so people would understand. We're reviewing an internal review of our existing consultant PCG's processes. We're holding them more accountable. They have been good to step up and try to give us solutions to mitigate future errors. And then we've partnered extensively with Mr. Frank Harwood and Bert Moore from the Department of Education and PCG to communicate with school districts and hear their concerns and update processes, et cetera, to the errors. In the very near future, which is like within 1 or 2 weeks, KDHE has a bunch of work group meetings scheduled with KSD staff from all over the state and district employees to continue improving those services. We're going to do training sessions, which will occur annually. That is something that I learned used to be done. This is like going back to 2010, et cetera, and had fallen off again due to lack of resources to manage the program and just getting back on track with that. So wanted to let you know we are on a path forward. There's no excuses. It was an error. And we thank the school districts and the Department of Education for their partnership in trying to help us rectify this and get everything squared away with the government. So I'll stand for questions unless you want more detail.
All right, thank you, Madam Secretary. So this goes back to fiscal year 2016, correct?
Correct.
And all 286 school districts?
Not all of them were impacted.
Not all were impacted?
No, 70% of them,
53?
Yes.
Okay. So do we have a list of the districts that were impacted?
Yes, we have.
You do have that?
Yes,
Oh,
we
it's
have
in there,
it.
okay.
And did we make that available to them?
All right.
Yes,
Yeah,
it
I
should
see
be
it.
in your
I see
packet.
it now.
Mine's bigger, but
All right.
yes, and if you want a big one, we'll get that to you printed big.
All right, thank you. And this was just basically a input error?
It was patients seen versus patients billed.
Okay.
So billed versus seen, 2 different things. So that's what it was. It was supposed to be anyone that was billed versus seen, and the number, and it was just the wrong numerator.
Do we have any school districts that are having difficulty in the recoupment?
No, we
No.
had a few outliers, but as noted, a lot of them had under $25,000 that
Right.
needed to pay back. So they've been very gracious about doing it. I shouldn't speak for them saying, every payback's a problem for schools, right? Just like hospitals, because money's tight. But no, we're not aware of anybody saying we're not doing this or we can't do this. And they've been very gracious about getting payback.
And as notated in your commentary, the Wichita School District was the largest at
Yes.
over $3 million.
Yes.
And there has not been any issue with them repaying that, or?
Not repaying, but I think we have a signing
Plan.
off on a paper issue, and we're proceeding as if they've signed off because
All
we
right.
have to get it done, so yes.
All right, thank you. Any questions for the Secretary? Representative Williams.
Thank you, Mr. Chair. Okay, so I think this is a totally different example, but I wanted to ask you about something that is related. I believe that the Senate Coach Committee maybe dove in a little bit to Medicaid reimbursements for special education. And I think that maybe anywhere from $12 to $25 million a year, and that maybe perhaps the state of Kansas is paying twice because they're not actually being submitted correctly. They're not going through our MCOs. They're just charging the state. Do you know anything about that and that potential error that is impacting our bottom line?
I
Madam
don't know
Secretary.
the answer to that, but I would say to note that this program, and I don't want to get too far out, but there's some of the resolution we're working on. It was established under fee-for-service versus managed care, so the MCOs don't have anything to do with this program. And so we have an option to move that, but it's going to be complicated and so forth. So I would note that I do not know on the education, the special ed issue. I'm going to ask our Medicaid staff if they know. No, nothing? No. We can follow up and find out what that is.
Mr. Chair, it would be appropriate if we could maybe talk offline about that and what those contracts for those MCOs are relating to, what services they're supposed to be providing for those students that qualify for Medicaid, and if they should or should not be submitting those claims through the MCO process, not being filed directly by the school districts, and then us therefore paying both for the MCO costs per student, but also for each of those individual fee-for-services. So if you wouldn't mind reaching out and emailing me, then I wouldn't have, then we can just move
We'll
on.
schedule it. Our legislative director's here, so we'll
All
get
right,
you
thank you.
scheduled and we'll get the right people at the table, okay? Thank you for the question.
All right, thank you. Senator Petty.
I was just noticing as I look through here, so even our School for the Deaf and School for the Blind, I mean, the School for the Blind had no miscalculation, but the School for the Deaf, so even our specialist schools had issues as well with how it was calculated. Yeah.
Yes.
Thanks.
Any further questions for the Secretary? All right.
Thank you.
See none. Thank you for being here. The next item that we have on the agenda, actually we're ahead of schedule now, is Lindsay Douglas in? Oh, sorry about that. We're moving on. I'm getting ahead of myself. So next would be Deanna Beard, the Medicaid Coordinator and Technology Program Manager for USD 259, which is the Wichita Public Schools, after I just asked the question about Wichita. All right. Sorry about that. Thank you for being here.
We are here. Good morning. Thank you, committee, for inviting us here to have the opportunity to speak to you, to share with you a little bit more about our experience and how working with KDHE and PCG and some of the other entities that Janet mentioned earlier. So first, I just kind of wanted to paint that picture so that you remember that Wichita Public Schools has over 46,000 students. 20% of those are special ed. In the state of Kansas, we can only bill for special education students receiving Medicaid services in our schools. With that in mind, our medical and physical needs of our students have risen dramatically over the last 5 years. I mean, 20, 30%. We have more diabetics, students on inhalers, medical problems. These are general ed students, yet we are unable to bill for those, but that's partially my testimony. So with that picture of who we are, I'll just let you know that as schools are increasingly tasked with providing comprehensive physical and mental health services to all students, it is critical that Medicaid be allowed the allowable services with the actual support being delivered. We need it to align. Despite the growing need, we are not fully utilizing all the federal funds available. Research consistently shows that healthy students learn better, behave better, and engage more effectively in their educational outcomes, and which is what we're all striving for. This particular situation underscores a broader concern for us because Kansas restricts Medicaid billing to students with disabilities, while neighboring states allow billing for a wider range of students with health needs. As a result, they receive 2 to 3 times more Medicaid revenue, and we are leaving critical funding on the table. These funds could support essential health services for all students. We recognize that Medicaid cost settlement is a complex process. However, as the districts are held accountable for the funding received, the districts deserve full data transparency. Currently, districts are excluded from key components of the calculation, such as this numerator mentioned earlier, used to verify the Medicaid eligibility of students who receive services. This lack of information from KDHE prevented us from validating the data and any ability to identify errors early. And I want you to know Wichita is one of the few districts, we do all of our Medicaid in-house. So we bill it, we source it, we reconcile it. We are responsible for all of the processes mentioned. So we have the ability to validate our data. And year one, when we went to this cost settlement approach, we notified PCG that this numerator calculation was inaccurate. We could not validate it. We specifically asked that they work with KDHE and get us the data so that we could show them that paid claims versus billed claims were not adding up for Wichita Public Schools. That message was ignored. We were not provided with the data, and we could have stopped this entire situation that we're in now had they given us the data, and we could have shown them where the error was. So Wichita itself, we were directly affected by the calculation error spanning 4 consecutive years, which resulted in it's almost 3.2 million for us. Had they provided us that calculation data, the discrepancy could have been found. So I've said that. Without full transparency, this could happen again. I want to give you another example as part of this administrative claiming process that we are not allowed to receive the data. We do a random moment in time study in which they survey our staff to see if what they are working on in this moment in time is Medicaid eligible. They do this thousands of times throughout the year. Then that data is used to comprise a calculation to determine part of our cost settlement. We have no problem doing this process. We support it. We encourage our staff to complete it. And yet, we are not allowed to see the data of how our staff responded, the percentage of staff that responded, how that percentage goes into the final calculation to determine our cost settlement amount. And as Janet supplied earlier, our cost settlement's $5 million. What's going to happen if there's another calculation error in that we're unable to validate? I could be standing up here telling you I have to return $10 million. We cannot afford to continue to make these kinds of mistakes when the data is there and we are able to validate it. So perhaps, in my opinion, perhaps this error by KDHE is a sign that it's time to reevaluate how to maximize Medicaid revenue to support all Kansas students. It's been over 15 years, and yes, I've been here for all of them, since we've had any meaningful change in the Medicaid process. So please allow school districts to participate directly in these conversations so we never again are put in a position to fund another institution's mistake. Thank you for your time and consideration. I welcome any questions you may have.
All right, and thank you for your testimony, Deanna. USD 259 is the largest school district in the state of Kansas, correct?
That is correct.
And obviously, in the previous agenda item, I mentioned that my hometown is Russell, and so we are in the Wichita market in regards for news, and so I always hear about the Wichita School District in regards to some issues. And so in the past few years, there's been some budgetary issues, I would say, with USD 259. I mean, they've closed some schools. There's also a bond measure that they're looking at.
Yes, sir.
Looking forward to. And so for $3 million to pay back, that's why I asked Secretary Stanek the question. So could you explain how that $3 million is going to be paid back in a payment plan?
Yes. So one of the things that we requested when this error came about was a detailed, comprehensive corrective action plan. What exactly was the error and exactly how were they going to respond to this? This is the first time I've seen it. So we asked for it. So yes, there's a sign-off problem because we asked to have this prior to signing an agreement to return $3 million without a plan that you're telling me exactly how this isn't going to happen again, for one, and for two, exactly what the error was. Because this is a little bit different than what we were told was the exact problem. This actually upsets me a little bit more because this is exactly what we reported year one, that the numerator error was wrong and we could not validate it. And we should be able to validate it because we reconcile all Medicaid bills that were paid and those that were denied, or whether they're ineligible or not. We know this information.
Well, honestly, and you're kind of an exclusion to other school districts, like, for example, USD 407, which is my home school district. They don't have an in-house Medicaid department.
Yes.
You do.
Yes. And we did
And
that
so there's
purposely
there
because
was
of
no
ourselves.
ability to reconcile what you had reported to what was found?
Oh, yes, we could, if they would share with us, because KDHE provides the third-party PCG, their number. We have the reconciliation, which is exactly what we told PCG. We have the data. It does not match up. Well, they said, well, it's a complex process. This is just a piece of the information. This isn't everything. So we have no control because we're not the agency that runs those calculations to determine the amount that we're reimbursed for this cost settlement. That administrative claiming piece. We submit this information, KDHE submits their information, PCG takes that information, runs these calculations, and then we get our information. It's been unsettling that that was the actual issue because we reported it year one. So.
Right.
But now that we have a detailed explanation and our money, but to speak on your behalf about the information of how we're going to recoup the money, we have an amazing CEO, or CFO and a CEO, but our CFO is amazing, and Addie is going to have to use some of our unrestricted reserve funds. We keep a cash balance for things like this, but there's no way that we would, if we continue to make errors like this, we won't be able to afford it.
Well, I'm just kind of wondering, you have an in-house department.
Yes, we do.
Other school districts do not.
Yes.
And if there was to counter some of the errors, you have the ability to do that because you have the documentation of what was submitted and what was actually
Absolutely.
requested. Other school districts do not have that. And they're just being, I mean, according to this list that I actually admitted to see before, but they don't have the ability to go back and see exactly what was billed.
Well, they're trusting a third-party company to do that. So what they're trusting a third party to do is to submit their billing, to reconcile their files, but they submit their student population. They should get that information back from their third-party biller to let them know how many students they billed on, how many they were denied, how many were Medicaid ineligible. All that data, because they're just doing a third-party contract for that service, should come right back to that school district. So it isn't that we were not told this was the actual error. We just were told it was KDHE had made a mistake in their calculation to PCG, but they never told us the underlying information. The power to change that information was out of our control. We're not allowed to put that in. PCG puts that numerator in. We're allowed to give the denominator, which is the number of students we serve.
And you have no idea what that numerator is, right?
Oh, no, they don't give it to us till after the calculation and the funding's done. And we've told them through a desk review. They even do desk reviews when they see that your numerator or your denominator may be too high or too low, and you have the opportunity to respond. In every one of those desk reviews, we let them know this is not our calculation. We do not match.
But still, your
They
school
give us
district is $3 million that has to be repaid back.
Correct.
Regardless of
Regardless.
what the information that you submitted
Yes.
to what.
Yes, because we do not submit the numerator. That comes from KDHE.
All right. Representative Ballard.
Thank you, Mr. I think you have answered, you've asked my question, but I'll follow up with, when you found the error, was it a phone call or was it submitted in writing?
We submitted it in writing as well as part of the desk review because we told we couldn't match that data, so we wanted to know how they were coming up with that calculation. And that's when we were told it's such a complex process that that's just a piece of it, not to worry that KDHE understands how they do this. And they implied it was considering all schools, district students across the state, not just Wichita. So that's why we wouldn't have the data. That's why we couldn't be given the data.
Oh, okay.
That's what they were
That was
saying,
my other
the-
question was, could you just get it just for your district?
That is
Because
exact.
That's who you're
Yes, ma'am.
responsible for.
That's what we were trying to get, was just our district, but then we were told the numerator is all districts in Kansas, not just Wichita Public Schools. That's why our denominator was just Wichita Public Schools. That's what we would provide, number of students served. So that's why it was too complex, and they were not allowed to provide us with that data of the numerator, which
May I
is,
follow up? Just one more question.
You may.
Is this a federal regulation that they can't singularly pull it out, or is it something that we do in the
well,
legislature?
our understanding after seeing this document from Janet, that should be our students paid and our students billed. If that is true, which I'll follow up and check, if that numerator is really just Wichita Public School students, then yeah, they've done a disservice to us. They should have been able to provide us those students because they're ours.
Thank you, Mr. Chairman.
Yes.
Senator Petty.
Thank you. And just, you mentioned in your testimony about what neighboring states are doing
Yes.
when allowing billing for a wider range of student health needs. And I'm just wondering if you, maybe not right now, but could provide, for example, with Wichita, if we were handling the Medicaid billing in a different manner, how much more would be available for Wichita, as an example?
Yes, absolutely. We actually have that information, and we're hopeful that part of the Medicaid expansion, I know that was declined, but they rolled in the opening the state plan for Medicaid in schools at the same time. So we kind of got bundled with the whole Medicaid cut. And I really wish we would separate Medicaid in schools so that they're looked at differently, because our regulations and rules for providing services are very different than community resources. You know, we have to have consent, we have to do all these things, and we have to provide these services anyway, which is why I think we're leaving the money on the table. What we were proposing at that time was at least to expand the opportunity to bill for students on 504 plans. Those are ADA compliant issues. Those are our highly medicated students who are requiring more care, some of our cancer patients. They're not students with a disability, but they are medically sensitive. And so those numbers and the mental health is going through the roof. And so and they get on these plans, so other states do documented medical needs. So as long as you have some kind of documented medical plan, we could get reimbursed. And so we had looked at some of those numbers, and we're hoping to get the opportunity to submit some of those for the expansion of Medicaid. So I hope that they'll reconsider it, because the numbers are significant. 20% of our population is all we're billing on. That's very low, and our socioeconomic standing is almost 80%.
Thank you.
Representative Carpenter.
Thank you, Mr. Chair. And to piggyback on what Senator Petty was talking about, I see in your paragraph here in the middle underscores a broader concern about Medicaid billing for students with disabilities. So are these other kids that you're talking about, are they on CHIPS? Are they eligible for Medicaid then, or are you advocating for a larger population of kids that don't qualify for Medicaid to be covered?
Oh, no, I'm advocating for students who do qualify for Medicaid, are getting Medicaid service. It's not CHIP, but they would qualify for Medicaid services in schools based on a documented medical need. So our students I'm asking for, which we were just going to try to slowly transition into 504 students. They have to have a 504 plan, just like students with disabilities have to have an IEP. Those students were going to be our next targeted group of students, because they're they have a higher medical need and it's documented. But the federal, the CMS actually allows us to bill on any documented medical need. So that would open it to any student who qualified for Medicaid. So I was only looking at targeting students whose families already qualify for Medicaid, allowing us to get the opportunity to be reimbursed for the services we're going to provide while they're at school is all we were asking for.
That's confusing to me. So they're already on Medicaid, so they can be billed for those medical services already?
Not in schools in Kansas, no. No,
Okay,
sir.
not in schools, but
Correct.
through another doctor or something?
Correct, yes.
So you're wanting to provide those services in the school and be able to bill for those?
Yes, and often because we have to provide them. If a student needs, let's say, a medication 3 times a day, we have them 8 hours. So we have to provide whatever the student's needs are. If they have the physical therapy needs, it's very difficult for our families to take their students out of school to get to physical therapy 2 times a week from being in a car accident when we could provide it in the school and keep them there. There's a huge correlation to the time children are pulled out of school to the impact on their education. So we want to support keeping our kids in school so that they don't miss out on the academics, but provide them necessary services so that they don't have to leave school for them, if possible. Now, we're not opening clinics or anything. We've got plenty to do. We're simply saying for the supports that children need during the day, we have to provide it anyway. They're going to the nurse for it. We're checking for it. We have asthmatic, diabetics. We have students with cancer. We have to do that. So we wouldn't deny them the medical care. All we're asking is the opportunity to be reimbursed from Medicaid for an allowable service that the feds will give us the funds for.
Very good. Thank you, Mr. Chairman.
Representative Williams.
Thank you, Mr. Chair. So I just have one quick question, and then I actually do have a few follow-up questions for the Madam Secretary, if that would be okay.
That's fine with me, if it's okay with the secretary.
Okay, and then just the quick question for you is we often hear about Medicaid reimbursement rates for services for your students while they're in school. Is that also a problem, those rates? And are they different than they would be if they were out of school and they were going directly for speech pathology or a counseling service? Or are they the same?
I can't speak to the rate because that's determined based off of the state sets those rates, and KDHE sets the rates of what we're allowed to claim. So I wouldn't know what it would be privately for a family versus what we would receive.
Okay, good enough. Mr. Chair, if I could direct a few questions to the Secretary?
You may.
All right, thank you.
Are you done with me?
Thank you, Dan.
Thank you.
So first of all, I wanted to go back to some of the comments that were made. One of the comments is about the PCG group. Do they have any contractual obligation to provide accurate data? And since this has been ongoing between 4 to 7 years, what's the clawback or responsibility that they bear for not providing the right information?
Madam Secretary.
Thank you for your question, Representative. You're not the first person that asked that question. I'll start there. We have no clawback opportunity with PCG. Contractually, we are, if we had any, it would be de minimis, the amount of clawback we are able to do. We are working with them to correct things and having them step up. And I respectfully am not on the same page as what was just talked about related to the first time seeing this information, the lack of information that we didn't or did give. I would like to follow up privately with the previous speaker to find out more about why there's this disconnect we have. But I can tell you PCG has stepped up and we are holding them more accountable. When I talk about no excuses, when I talk about having staff and consistency to oversee even the contractor on this, I would say it was loose because we are limited in staffing. We are going to look at adding positions to manage, even though you have a consultant or a contractor, as you know, somebody's got to manage them too. And I would say it was loose, and that's on us.
Okay, thank you, Madam Secretary. So I would like for example, the document that you provided, 259, provided to the chairman if he's, would like that, and that we could all see it.
I would be
Yes,
glad
please.
to. There was follow-up, and Haley, correct me, but every school district got an individual follow-up with their specific information immediately following the all-schools call we did, where we had all of what I've just provided in testimony laid out. We did FAQs. We explained specifically. I was on the call. So we, again, have a disconnect that I'd like to privately follow up with the previous speaker on.
Okay, and so coming back to PCG, what is the contract, the annual contract award for them, doing their part of the calculation? What is, yes, what do they receive annually?
I will ask my staff, but if not, I'll have to get you that answer.
Okay, and so coming back to that, I feel like that's very important. We have an error that's been ongoing, that has been identified, has been shared with KDHE. No corrective action was done. PCG knew that this error existed, and they didn't double check their work in any way. And so, again, it's kind of disappointing that we have contracts which we don't know that award amount, and yet it's not outcomes driven. So that's kind of sad. So I would hope that KDHE would take a hard look at the types of contracts you're engaging in for the state of Kansas and holding those contractors accountable when these errors occur. So that's disappointing. And then the last question I have is about your support and efforts that you provided in your testimony, the corrective action that you listed. You have bullets that say that you're going to add additional senior level resources, you're going to take a further review, but you're going to call these districts. But I don't see anything that allows for the check and balance that Deanne mentioned. And that would be that it's transparent process, that the information either through PCG or KDHE is provided to the school district so that there can be a proper check and balance. So would you commit to incorporating more transparency for school districts so if there is a disconnect in the numbers, they can identify where and the problem can be corrected much sooner than 4 years down the road?
Yes, and if I may just give you the history real quick and tell you what we think happens. When this was developed in 2010, the methodology that was developed based on the thought that KSD had the same information that KDHE had. When it was discovered that they did not, and this has to do with systems issue and things that I can't speak to because I was not here, what they landed on was that the alternative was that KDHE would pull the numerator from paid claims. Consideration was given to having districts self-report the data, but the overall decision to use paid claims was twofold. It was a source that consistently be pulled from a system, and it had undergone a review process, and that it would encourage school districts to continue to submit services for reimbursement so KDHE had access to the service delivery data. The denominator was always to be reported at the district level, so KDHE did not, because we didn't have access to that information. This again has to do with information systems that were not accessible to technology and or confidentiality and so forth. During the desk review process that was referenced earlier, districts with a high IEP ratio, which Wichita would have been one, are flagged and they're asked to confirm the accuracy of their information. They also review and certify this information during the cost settlement review process. At the beginning of the testimony, I noted that in the 23 review process, the one where the error was discovered, I'm sure Wichita was one of the districts. They weren't the only one that said, we think something's wrong with this data. So I don't know why and can't speak to why it was just caught in the 23 year. We do know, Wichita probably not being one of them, obviously, if they reported it, but there's a lot of school districts that don't do the checking. They just trust what the system says. So that's where we're working on our corrective action plan to fix that. I hear your points about holding the contractor accountable, making sure we have a better true-up system, and making sure particularly the school districts that have the higher stakes, like Wichita, that we get on the same page. And we're committed to working on that and that's ongoing right now. And again, KSD is also helping us with that and trying to get communications and so forth out to the school districts. We'll be happy to give you updates on how we're doing with this as well.
Thank you, Madam Secretary. That's exactly what I was going to ask, is that there be follow-up on these issues in particular.
Yes.
And that they would be satisfactory to those school districts so that this would not happen again and that there would be no worry about this happening again, certainly in this way. And I'll
Yes.
also follow up on the other question I had about Medicaid reimbursement.
Yes.
Thank you.
Yes, and the Medicaid to expand into the medical services and so forth that was talked about by the previous speaker, that requires a state plan amendment change and all of these other things that we're going to look at, back to being fee-for-service versus managed care. It'll be a process to get that changed if we explore that, but it is on our list of review. And again, I'll make sure that that is in our updates to you in the future. Any other questions, Chairman?
All right. I think that's it. Thank
Okay,
you,
thanks
Secretary
very
Stanek.
much.
And
Thank you.
thank you, Deanna, for being here. We're going to go ahead and move on to the next item on the agenda before lunch, and then it's going to be a World Cup update. So we have, I saw her walk in, Lindsay Douglas, with the Chief Operating Officer for KC 2026. Ms. Douglas, welcome to committee.
Thank you, Mr. Chairman. And I know we have some slides as well. Do I need? Oh, they have it in front of them? Oh, well, I'll just talk off that. Perfect. Thank you, Dylan. Well, I am thrilled to be here with you guys today to provide an update on World Cup planning and efforts. This has been a pretty significant undertaking for the entire region, and so appreciate the opportunity to be here. That first slide is my heart rate slide. 289 days before the start of the 2026 World Cup. We are constantly at KC 2026 paying attention to the amount of time that we have remaining to make sure that all of our plans are ready and assets are acquired in preparation to host. And the next slide there just is kind of a reminder, many of you have seen these, but the World Cup is the largest sporting event in the world. This will be the largest version of that sporting event in 2026. So this, even though soccer is one of many sports that we follow here in the United States, by far at the world stage, it is the largest. It has the most number of players and the most number of fans. So we anticipate that half of the world's population will tune in for a match next year. So the opportunity to have those eyes on Kansas City is really, really exciting. The next slide is an overview of the entire tournament and the schedule. It shows you, the duration and the just sheer volume of activity that is going to be taking place for 39 days next summer. Kansas City is that bottom green row and shows our 6 matches. We do have a quarterfinal match, which will be huge for our region from an economic development opportunity perspective. Those teams that make it all the way to the quarterfinal typically have a lot of fan base that will follow their team and come to our region to attend and watch that match, or even just be in the realm when that match is taking place. So it's really an exciting opportunity. And then the next slide is our specific matches. The 4 group stage matches, the round of 32, and then the quarterfinal. These are key activity days for our region. Thank you. Perfect. Key activity days for our region and will be, we know, peak days for Fan Fest activities as well as other visitor activities that will be taking place. And then I included the map of the other World Cup venues. These are all the host cities. We have 2 in Canada, 3 in Mexico, and 11 in the United States. We are the smallest host city here in our region, but what we lack in size, we are definitely dedicated in making sure this is a good experience for the visitors and for our residents that will be here. So I'll talk a little bit as we work through planning in a number of ways that our region is leading in all of the host city planning. Really excited about some of the leadership we've been able to show with the collective host cities. KC 2026, as a quick background, is the regional organization that was formed to fulfill all of the FIFA host city requirements. That includes everything related to hosting the tournament that FIFA is not taking care of. And I'll go into a little bit more in depth on that. But our board is made up of regional leaders from both sides of the state line, both Kansas and Missouri, different local jurisdictions in the region. And they've laid out this really guiding principles and goals for our team to really focus as in every planning aspect that we do, that we are really maximizing the momentum that hosting this event will create, and to really raise our region on the world stage. We want to do that through uniting and strengthening the partnerships and the cooperation that we already have in the Kansas City region. But there are certainly things that we've never done before together that we are doing for the first time. In doing that, we know that we need to deliver Kansas City magic. When people come to our region for the World Cup, we don't want them to think, oh, we're just in another World Cup host city. We want them to know where they are, and that'll be reflected through our culture, our welcome, and just different attributes that our community and different cultural pieces that our community has to offer. We want to rise on the world stage and take advantage of that, from business development, business attraction, and just how we're hosting. And then we want to make sure that this isn't just, I call it a flash in the pan, right? We don't want to just see that economic activity just during the tournament. We want to figure out how we can build that sustaining long-term impact with a legacy coming from the World Cup. And I mentioned our role and responsibility for all of the requirements related to hosting. So our organization, with the partnerships that we have in the region, are responsible for all of the safety and security at base camp locations, at Fan Festival, any KC 2026 events that are being hosted, and then outside of the stadium. So any public safety responsibility at the stadium during the matches is KC 2026 responsibility. So all of that safety and security work and coordination is really being facilitated by our organization. Obviously, we're not law enforcement, so we are partnering with the law enforcement agencies, the folks that have the authority to really build those plans and implement them, but we are making sure there's kind of a coordinated effort across the region. And then on transportation, we were definitely starting in a different place regarding public transportation compared to many of the other host cities. So we have responsibility to make sure there's transportation to move people from the airport to downtown. It's not a firm definition, but essentially moving people from airport into the region, moving people from the regional area to the stadium on match day, and then also making sure people from FanFest can get to the stadium as well. So we've really been working on building a transportation system that's going to layer on top of the services we have today. So if you think of public transit, I'll use Johnson County as an example. They have existing routes in Johnson County. Our public transit that we have available in the region is not going to be substantial enough to move the 650,000 or so visitors that we're going to have. So we knew we needed to stand up our own system for the tournament that would enhance and leverage the existing system, but really build out and almost double the capacity of the transit system we have today. And then on human rights and sustainability, FIFA has required that we consider obviously both of those areas and how we are delivering the tournament, and it provided guidance to us on how we should address those things. So we have action plans for both human rights and sustainability. When you think about human rights, a big area that is a focus is human trafficking. So making sure that we're bringing some training to the hospitality sector in our region and things to watch out for related to human trafficking, and then making sure we have resources assembled to provide people, safeguard folks, and then provide them an access to remedy to help them and assist them out of their circumstance. And then on the sustainability side, when we think about FanFest, big sporting events like this and festivals generate a lot of solid waste. So making sure that we're thinking about that waste stream and looking for ways to recycle some of those kinds of practices as we are thinking about FanFest as well. And then, of course, the FIFA Fan Fest. It will be located at the World War I Museum and Memorial. We're utilizing the lawn at that venue to really host the biggest watch party in our community. Our anticipated capacity at any one time will be 25,000 at FanFest. We intentionally made that a bit smaller. Many other cities' FanFests are going to have much larger capacities, but we knew we wanted people to experience other areas of our community. So where people will come and spend a day at FanFest, they may catch a watch party in Lenexa or outside, maybe Wichita, going to Dodge City, taking a road trip. There's a lot of international interest in Americana, and some of the tourist attractions that we have in Kansas are going to be perfect fits for kind of what they're looking for. And then volunteer program, we know we're going to need thousands of volunteers to make this an excellent experience for visitors. And so we've really deployed volunteers in every aspect of what we're doing, obviously not on the safety and security side, but related to FanFest at the airport, really being that opening welcome to people as they come to our region. And then economic enhancement, making sure we're delivering on that about $653 million in economic impact that we anticipate seeing. We want to make sure we're leveraging that and bringing as much economic activity to the region as possible. And thinking about not just in the moment, but also how are we expanding small business? How are we giving them opportunities? And how are we attracting additional business? With all the world leaders that are coming, how can we really create a trade mission in our backyard? If people are coming to us, how do we showcase our industries here? And I'll talk a little bit more about that in just a minute. All right. So I mentioned the $653 million in direct event economic impact. This is really just based on the 6 matches that we have and the number of visitors that FIFA is projecting would go along with those 6 matches. There are a number of opportunities that sit outside of just the matches that we have not accounted for in this estimate. For example, the base camps. We know now that a few teams have come through and toured those locations. It is a very attractive opportunity for us. Our facilities are really excellent, and everybody wants heat and humidity to acclimate their teams, to prepare them to get ready for World Cup. So Kansas City can deliver on those things. And so we're really excited about the opportunity that poses, and think we have a really good chance of filling up our base camps. We have the potential for 3. We'd be really, really excited if we got 2. So we're trying to make sure that teams that are coming through get exposure to that. The reason that's not factored in is because we don't know for sure that anyone would select Kansas City. But I've got a map coming up that'll show you why we think that's a really great opportunity. The visitor profile for those coming to the United States for the tournament, again, that's about 650,000 for us in the Kansas City region. About 54% of those will be international visitors, and they're going to stay on average almost 10 days. 9.7 days is the average. So we know that they're not going to want to be at FanFest every one of those days. So making sure that we're providing opportunity and communicating opportunity to get out and about and see other attractions while they're here. And then really, we think that is the key opportunity. With all these folks coming, how are we promoting Kansas to the world? We are thinking about and already routing people to the ks.gov website. We're working really closely with the Department of Commerce on how we are showcasing our state. We're definitely giving a lot of earned media and PR as we are leading in several of these planning categories. We're kind of put up front. In fact, our CEO, Pam Kramer, today is meeting with the White House Task Force on safety and security items. And so we're getting that sort of national attention as well as international attention related to the tournament. And then just continuing ongoing promotions of attractions that are in our region. We know that if we have an intentional focus on regionality, we're going to be able to really be jurisdiction agnostic for those visitors that are here. And we're doing a lot of work to promote these things on an app that would be paired with the FIFA World Cup app where the ticket lives. So if you go to a Royals game or a Chiefs game, you have to go into their app to access your ticket. The same thing will happen for World Cup. We will have a whole component piece of Kansas City for those people that are located here and attending matches here. And then KC House. I mentioned Trade Mission in our backyard. We want to build an immersive Kansas City experience where we're really getting to showcase the industries that are in our region for world leaders that are coming through. So we know that a lot of C-suite executives from the other countries are going to be coming through to watch their teams. We are working with FIFA and other partners, KCADC, about identifying who those folks are that are coming and really kind of capturing them, giving them really unique access to our region, entertainment, things like that, that we would be hosting at KC House. A number of our private sponsors are also very interested in this asset. So we really want to maximize that for the tournament and make sure we're getting the biggest bang for our buck out of business attraction and really telling our story through this. And then on the local and small business opportunities, we do have a business interest form. I know many of you on the committee have said, hey, we've got a business that's interested. The business interest form is a list of, I think we're close to 2,000 businesses that have signed up now that are interested in RFIs and RFPs that our organization is sourcing, but also related to any community members. We put it as a disclaimer that we were going to share the information provided to us from that business interest form to other folks that are interested in finding maybe event hosting, lodging, anything like that that could kind of fall into the different categories we're collecting business information for. We're happy to share those business names and interest to other people that are looking for that as well. And then back to kind of focus in on the training site opportunities. So there are two different types of sites. The venue-specific training site is where teams that are playing at Arrowhead will train before their match. Those are Children's Mercy Park, the Sporting KC Stadium, and CPKC Stadium, the current stadium. So the stadiums are being utilized, but they're match day -1 training for the teams that are playing at Arrowhead. The team base camps are really the team's home away from home. Those are the locations where teams will come and train to prep for the tournament. There's a hotel associated with that. These teams are going to bring their entire support staff, sometimes their families. So the influx of folks that come with a team are pretty substantial. And we are really excited in our region that we have 3 different locations. Compass Minerals, which is the Sporting Kansas City's training facility in KCK. We have the KC Current Training Facility in Riverside, Missouri, and then Rock Chalk Park in Lawrence. All 3 of these facilities kind of cater to different types of teams, but have been getting rave reviews from the teams that have come through. Each of these are then paired with a hotel as well. Teams like to bring a chef, their own nutrition plan, and they like to be able to have a fully controlled opportunity to make sure they're providing their team everything they need to compete at the highest level during the tournament. And our facilities have been really phenomenal, both hosts for these teams, but also to really showcase the best facilities that our region has to offer. And the reason this looks so good for Kansas City, we have 3 of the 65 to 68 locations that are in the FIFA brochure. There will be 48 teams playing in the tournament. So when we think about us having 3 of those, and then on this map, you see all of the cities that are white are host cities for the tournament, but they do not have any base camp locations. So if you're a team and you want to pick a base camp that's centrally located, easy to get to the other host cities, and you may be playing in that city, Kansas City is looking pretty good. Some of these areas, they're continuing to look at opportunities and looking to add facilities. So this map may not be static. It's definitely a living document. But for right now, we're looking pretty good so that teams can prepare and really prioritize their base camp locations. And I should be really clear on this. The way that this works, the teams, as they qualify, or even if they anticipate qualifying, have come to the United States. They've toured, or Canada and Mexico, toured the base camp locations. They are working on prioritizing their list of their favorite locations. And then once the final draw happens, they will be paired with their base camp priority locations by FIFA. So final draw will take place on December 5th in Washington, D.C. at the Kennedy Center. That'll be a really exciting time to learn what teams will play here in the group stage. And then we will find out base camp decisions pretty soon after that in that January timeframe. Even if not all of our locations are selected after that December 5th final draw, there will still be 6 teams that will qualify for the tournament in the spring. So 6 teams, we won't know about those. They will have to quickly find base camp locations after they qualify in March. On safety and security, I won't spend too terrible much time going through this, but there are 18 different areas of focus where we are creating a safety and security framework that would be all-inclusive of both the safety side as well as medical for our region. There are several subcommittees that are making up the planning and doing the planning in each of these areas. They are made up of representatives from both sides of the state line. We are all working together, and at the end of this, we are going to have a multi-jurisdictional safety and security framework that can be used again in the future, taking into consideration the venues that we're utilizing. It'll be an asset that will continue to live on, but this has never been done in our region before, and we are doing very well in making sure that we have all of our venues risk assessed and security plans, ingress, egress routes identified, all of those kinds of things to go along with the safety and security planning. This is a quick snapshot of the Health and Medical World Cup Coalition. We have members from FIFA as well as our local region, hospital representatives, and are working to share information across all of these areas. And the Kansas Department of Emergency Management is very involved in these committees and in this process as well. And they are already coordinating and have coordinated for some time with SEMA on the Missouri side. But this partnership has really been working well to give folks a view into really the buildup and the full regional framework as we continue to advance that planning. On the transportation side, I mentioned we had to build an overall layered on top of additional service in the region. We are doing that through working groups as well. All the local jurisdictions are involved in kind of helping problem solve and plan to how to make this transportation system be as seamless as possible. We know full seamless when you're crossing jurisdictions, crossing different organizations is going to be challenging, but we're really working together to make sure that the visitors have as seamless an experience as possible. Oh, those got duplicated. Sorry about that. And then on community engagement, we have developed a regional calendar for events. One of the tools for safety and security planning is understanding where the needs are in the region for safety and security, for police departments, for fire and EMS. We want regional communities to add their events to this calendar so that we have a full view of where those assets are going to be needed. We also want to incorporate those and pull them over into the app so that visitors know all of the opportunities and things to do that are going on in the region. We are working really hard to get people to populate that and permit that. And then obviously the KC 2026 website, we're sharing lots of information there, as well as on our social media channels. That's a big repository for the small business work that we're doing as well. We want to provide some predictive analytics for small businesses so they know how visitors are going to travel throughout the region. And so they know if you're a business and at your specific location, you may not have as many visitors as you would expect. You're not, going out and purchasing a lot more food to serve customers that never come. So we're trying to help businesses really scale correctly so that there isn't any waste or lack of investment happening. And then I know that a question came up on a previous presentation. So we were really, really excited on the safety and security side that the federal government allocated $625 million from the One Big Beautiful Bill to provide safety and security investment for all of the 11 U.S. host cities. Our portion of that is still TBD. We expect it to be around the $50 million range. That money is absolutely essential to us being able to have multiple days of FanFest, really be able to have the robust safety and security that we need. And when we were developing different budget scenarios, as this committee is very familiar with, we were really hopeful that those federal dollars were going to come through. Without them, we would have just had to scale down what we were trying to accomplish and how much we were trying to do in the region to make sure we had a safe event. That money is going to be essential. And one of the things that I know, Chairman, you mentioned, the funding that came from the state of Kansas. So we have a grant agreement with the Department of Commerce. We have allocated Kansas funds across all of these areas of planning that I talked about to really reflect and bring the biggest impact for the state of Kansas. So whether that's business attraction, tourism, as well as transportation, those are the areas where the primary bulk of the dollars are invested now. We did have some money allocated to safety and security. So as soon as we see that NOFO come from the federal government and really understand exactly how much we're getting, we'll likely have to go back to the Department of Commerce and reallocate the Kansas dollars across different planning areas within our budget because that 625 is full funding for the 11 host cities. So we had submitted budgets, sorry to get wonky on you. We had submitted budgets to a third party. Every host city submitted their safety and security budget. All of those budgets were validated and consolidated together. When OMB did a similar exercise of what they thought the investment level would be for a safety and security effort, the size of World Cup across 11 cities, we were within 2% of their estimates, which gave elected officials a lot of comfort in knowing that we were really just asking for what we needed. They felt comfortable enough to fully fund that request at $625 million. So we will be able to reallocate any other resources that we had identified for safety and security to other areas of the event. I'd be happy to stand for any questions.
We'll have a few questions real quick before we break for lunch at noon. So I'm glad you mentioned the $50 million that's going to be received from the $625 million from federal funding for the World Cup.
We're waiting to see the exact amount, but we're thinking it's going to be in that range. So don't quote me exactly on the number, but we're waiting to see we are going to find out. They told us October 1st-ish. They will release a notice of funding opportunity that will really identify what our allocation of that 625 will be.
Okay. And then you had mentioned that the teams are going to be announced on December 5th?
That's right, for our group stage matches. So once the final draw happens, Pam correlates it often to Selection Sunday. Once we know what teams are playing here, we're going to know that first tranche of countries that'll be coming through our region.
Okay. And one thing I will admit, beginning of August, I attended NCSL in Boston, which is also a host city.
Yep.
And they were heavily publicizing the fact that Boston is a host city.
Yes.
And I know Kansas City is doing the same, but he also had the ability to address about 5,000 people who were sitting there from across the nation saying, come to Boston for the World Cup. So one thing I wanted to talk about in regards, there was a notation in your testimony about the average hotel room is $299, I believe. is what I saw.
Okay.
And I just have to admit that I'm not to say this is going to be price gouging, but my wife is a big Hallmark fan. And Kansas City has the Hallmark thing that started last year in November and December. And we were coming through back on Thanksgiving from my sister's house in Iowa and stayed in Kansas City that night and couldn't find a hotel room because of the event that was going on surrounded by Hallmark and Crown Center. And the Westin was $700 a night because of that event. So I'm just wondering, because of
Yeah.
the World Cup lasting for 39 days, what hotel rooms are going to be running in the Kansas City area.
So, Mr.
yes.
Chairman, if I may, I know there are lots of folks looking to take advantage and utilize the opportunity if hotel rooms are going to be really expensive. We know people are going to be traveling some distance to come into matches. We've talked about 55,000 hotel rooms that was part of the bid. We know that people are going to travel 2 to 4 hours outside. If they can't find accommodation within the metropolitan area, they're going to be looking outside of that and then traveling in. That's a pretty common practice for major sporting events. We also know that VRBOs, Airbnbs are going to be in demand, and market is going to demand lots of things. Also, campgrounds are really looking at this as an opportunity as well. And so I would imagine kind of every type of accommodation will be maximized to host the number of visitors we'll have.
So I know there was a 250-mile radius when I think you addressed this with the Appropriations Committee. And so, and now it was brought to me, I believe I asked a question in regards to working with school districts in regards to busing.
Yes.
Has that been utilized?
Yes, it has. We've been talking with them. The board has provided us guidance that they really want the public transportation option to be a good experience. I think many of them have attended World Cups where school buses have been utilized, that not having air conditioning and being stuck in a bus for a long period of time or stuck in traffic led to maybe not the best experience, but we still have a number of workforce that we're going to have to move with a transportation solution. So we're looking at how we can plug in those school assets where they own their fleet and it's not a third party, to see if we can utilize those and have access to those for other transportation needs that we have in the region.
All right. And then I know Representative Williams and I just came back from Ireland on a legislative tour, and also with the game that was played with K-State and Iowa State. And I happened to notice that in Dublin, there was a lot of currency stations. And maybe in Kansas City, I haven't noticed that because I don't have to convert currency. Is that something that's being kept in mind?
Yes, I would say that our planning, definitely in our conversation, in our line of sight, I think this is going to be a combined host city challenge to make sure that we have plenty of currency exchange opportunities. For folks that are flying in, we were just talking with some of our CVB partners about this as well. A lot of currency exchange happens at the airports. Until we have more direct airports, I don't think we have a permanent currency exchange. I think we have some cash to card machines at the airport. But that first airport that they land in after customs, they're likely to want to do exchanging there. So we're talking about some of those connecting airports and communities. But I think we need to continue to advance that conversation around currency. It is something that we are very attentive to. On that visitor profile that I shared, 65% or 66%, maybe a 68% of the international visitors will have a debit or credit card that work in our banking system. So the opposite side of that, they're going to have mechanisms in place to, whether that's electronic payment systems with their phone, things like that, to help transfer. We're also using Visa. Visa is a commercial partner of FIFA. We've been having some conversations with them about what assets they could bring to our region to help with that currency exchange and help bring some tools as well.
Okay, and the last comment before we break for lunch is you were talking about waste at the at Liberty Memorial when you're talking about the Fan Fest.
Yep.
And I would just revert back to Walt Disney. When he was a kid, he would frequently go to Electric City outside of Kansas City when he lived there as a child, and he worked for the Kansas City Star. And then when he decided to build his own theme park, he actually evaluated and watched individuals, and you have a trash can that's 20 feet within each other. If it's longer than that, then people just throw it on the ground. And Walt Disney happened to look at that, and that's why in Disneyland and Disney World you have trash cans that are only 20 feet apart. So,
No, thank you. Thank you very much.
all right. All right, committee, we're going to go ahead and break for lunch, and we will return probably around 1:15 instead of 1 o'clock. We are in recess. So I'd ask that Ashley Gose, the Department of Secretary for Public Health, to address the committee. Welcome to committee.
All right. Good afternoon, Chairman Waymaster and members of the Legislative Budget Committee. Thank you for inviting us to speak about the recent changes to our lab courier service provided by KDHE. I'm Ashley Goss, Deputy Secretary of Health and Environment. You have my testimony in front of you, so I'm just going to go over a few talking points and, of course, happy to answer any questions. Our state courier service was originally established in 2021 using COVID funds, which allowed for local health departments and our public water systems to have their test samples delivered to ks.gov, which allowed the turnaround time from collection to result to greatly improve. Last year, ks.gov received just over 154,000 samples. Of those, just over 81,000 of them arrived via lab courier. Looking at the 2 years prior to the courier being established, the average transit time from collection to delivery was 3 days. Since the courier has been in place, the average number of days from collection to delivery has now been reduced to 1.8 days. The benefits of having a reduced transit times means patients receive results much quicker, which significantly impacts direct patient care. In addition, earlier notification to the public water supply allows them to react timely, whether it's for a hazardous incident or even to lift a boil water advisory. There are specific samples that are considered to be time sensitive, and many of these would be, meaning that if they're not run in a set amount of time, then they have to be collected again. This is true for water as well as health samples. Some of the sensitive tests only have 30 hours to which they can be run, or they have to be recollected. Of all of our specimens that we collected last year, 78% of those were time sensitive. KDHE has worked to find alternate sources with the federal funds being cut. As you'll see on our attached map, we have drastically reduced the courier routes in order to make the funds last through 2026. I'm sure many of you have heard from your water suppliers or your local health departments who were affected by the cuts. Prior to July 1 of 2025, we had 464 environmental clients and 132 health clients. After July 1 of 2025, the routes were greatly reduced, only picking up for 192 of our environmental clients and 58 of our health clients. Those that have been dropped have had to fund through their local budgets. As of July 1 of 2026, local partners will be responsible for all shipping costs through their local budgets unless other funds are found. And that's all I have. The rest is in our testimony. You guys have a colored map, or should have, as part of our testimony that was submitted, so you can see which counties are impacted as far as having a courier still that picks up the service for them. And I'm happy to answer any questions.
All right. Thank you, Ashley. So I guess my first question, because actually one of these counties is in my district, for like Osborne County, who do they utilize?
To bring it, now they're going to have to, if they were dropped from the courier, then they have to find an alternate source. So I don't know if they're shipping them, paying for UPS or FedEx, which I might add, we've been researching that as well because it could be cheaper, significantly cheaper than a courier. However, Osborne County probably is not exempt from this in a lot of our rural counties. There's no guarantee that FedEx will get here in one day or that UPS will get here in one day, and the Postal Service is usually not a go. So I don't know who they're using right now.
Okay. All right. Thank you. Any other questions for Ashley? Representative Williams.
Thank you, Mr. Chair. So if we were to look at this program and just use something like FedEx and pay for the one-day service, wouldn't that be more cost effective?
It absolutely would be, and I actually have our deputy director for the lab who has been researching that if you want more specific information. But even with that, when we were talking with our locals, again, in our very rural counties, they have said that it's still not guaranteed that they can get a pickup. That's the biggest problem, is getting it picked up by one of those providers. Because we can pay for it to be shipped here, it would be significantly less. The problem is getting one of the carriers to actually stop.
So are you suggesting that there are some counties that do not have any FedEx drop location?
Yes. Can I call Paul up and he can tell you what he's found?
Yes, you may.
All right.
Hello, Chair Waymaster. I'm Paul Harrison, Deputy Director for the Kansas Health and Environmental Laboratories. With regards to that question, we did some outreach to local health departments to get their understanding, and many of them wrote back to us and told us that they cannot get FedEx. They don't have a FedEx drop location in the facility. We have reached out numerous times to UPS to try and get a quote for services. Say I have these locations, and it's approximately this number of samples, this many drops. We're having a lot of difficulty getting them to get a response back to us, but we have at least started that process, and we're waiting for them to hopefully give us a quote, a dollar figure back, so we know what that cost would be.
All right, committee, any other further questions? All right, thank you, Paul. Thank you, Ashley. Okay, now we're going to move on to the next item on the agenda, and that's the federal and state regulations at Wilson State Park. And so I'd invite Willis Ohl, the Wilson State Park Manager, to address the committee. Mr. Ohl.
Thank you, Mr. Chairman, and committee for having me. My name is Willis Ohl. I've been with Wildlife and Parks for 21 years. I started out as a ranger at Canopolis State Park in 2004 and slowly worked my way up to manager of Wilson State Park, where I've been for the past 15 years. And if you have any questions about Wilson State Park, I'd be glad to answer them.
Well, and the reason why I have you on the agenda, and obviously living in, well, actually having Russell and Ellsworth counties in my district and Lincoln, I'm very familiar with Wilson Lake because it's, you know, right in my backyard pretty much. There's been some changes that were made in regards to camping policy in regards to Wilson Lake, and that was done by the Corps. And there's been some entities like the Marshall Cove, I don't know what the actual title of their committee or group is, but it's the Marshall Cove Dock Owners Association.
There you go.
They had a meeting, I believe it was in May, and possibly in June. And there's like 180 people that attended due to the changes that were made. And there's a fear that is Wilson's, and clarify this, is Wilson State Lake the only U.S. Corps lake that has docks, or is there other lakes in the state of Kansas that
I believe Perry Reservoir has private docks as well.
They do, okay. So the concern is that with the new implementation of the policy in regards to camping outside of your dock, and not allowing you to do so if you have an RV or a camper, this is a slow process of eliminating docks at Wilson Lake. Because when Wilson Lake was created, there was how many docks?
I believe there's a thing that they've handed out, a paperwork that they've handed out that deals with the Corps, and I think it was 74 grandfathered in. Now again, I don't work for the Corps of Engineers, so I can't answer on the Corps of Engineers. I work for Wildlife and Parks. So if you've never been to Wilson State Park is broken into two entities: the U.S. Army Corps of Engineers, who operate Manuka, Lucas Park, and Sylvan Park, and then Kansas Department of Wildlife and Parks. We lease Hell Creek and Odo. So I manage Hell Creek and Odo. So I take care of everything, the camping, vehicle permits, everything that happens inside the state park, which is Hell Creek and Odo.
And so where does Marshall Cove fall into that?
Marshall Cove falls into Manuka Park, which is a Corps of Engineers park.
Okay, so that's where the area of concern is at, is that the U.S. Corps, and we have a dock on Wilson Lake.
Okay.
And it's obviously regulated by the Corps. I mean, so we have a permit that comes out and says your dock is in good standing, you're okay. This new policy that came out in regards, and now the U.S. Corps says it's because of a lack of law enforcement, of not allowing an individual with a camper to camp beside their dock. And so they eliminated that as far as what, May 15th?
Somewhere around there, yes. That's when we were notified that they were closing down camping in Marshall Cove.
Right. And so that's one area of concern. And so there's some individuals who are upset that you can no longer camp by your dock if you happen to own one. The next is I had a conversation with Secretary Kennedy when actually we were at the Law Enforcement Training Center ground opening in Yoder. And it's been brought to my attention, and I don't know if it's been brought to Senator Billinger's attention because he obviously has individuals who have docks in Wilson Lake as well, because Ellis County is in his district, and that's not that far away. And people have brought to my attention, well, can the state take over the regulation of the docks instead of having the U.S. Corps do it? And again, the fear is that they're going to eliminate docks on in the future. And the reason why is because when they first had docks on the lake, there was quite a bit more than what there's currently is now. And people are just concerned that they're going to completely eliminate the docks on Wilson Lake.
Okay. I can't answer for the Corps as far as, you know, as far as if they're trying to get rid of docks or not. I don't know that part. As far as the state, I can't answer for maybe the state taking over the docks. If the state was going to do that, we would have to take over Manuka Park. And then I think those would still fall under Corps of Engineers regulations because they still manage the ground and the water. Like I said, we lease, so we would have to lease that ground, and they would still have rules and regulations in place that we would have to follow.
Right. Well, and like in the conversation that I had with Secretary Kennedy, his first response was, well, it's going to take more money. And I said, well, give me a figure on what it would take. I mean, that way I can go back to constituents and say, if we were to take this over as far as the state and not the U.S. Corps, this is how much we would have to appropriate in order to take that over. And he still hasn't, I'm supposed to be setting up a meeting with him, so I haven't talked with him lately since about that. But the other question I had is, there's also been some new regulations in regards to staying on your boat. Is that correct?
As far as?
So the new regulations are that if you have a, let's say, like, and I'll give an example of myself, we have a houseboat and we have a dock, and now they're saying that we can't even stay on the houseboat at the dock. If we want to stay on the houseboat overnight, we have to go out on the lake and anchor and have special lighting on it. We cannot stay on it on our dock. Is that correct?
Again, that was going to be a Corps of Engineers rule, not a state park rule. I don't have the answer for that because I don't know what they make as far as rules and regulations. The only rules and regulations I get to uphold are state statutes and state regulations in the state park. I can go over to the Corps of Engineers and do certain things, like if there's an emergency or if there's something over there, but I don't patrol their grounds. I don't go over there unless there's an emergency that has happened. You know, for example, if somebody gets hurt, I can go over there and render aid. Or if, you know, earlier this year we had a drowning, unfortunately,
right,
I could go over there and I could help locate and recover. As far as going over there and patrolling and doing their rules and regulations, I cannot enforce their rules and regulations. Therefore, I don't learn all of their rules and regulations because that one doesn't affect me because we don't have docks like that in the state park.
Okay. Well, I was just kind of wondering because, I mean, nothing's been told to us specifically, but I've heard this through the grapevine, and so that's why I was kind of asking that question.
I understand that.
Whether or not it changed. Senator Billinger.
Thank you, and thank you for being here today.
Thank you for having me.
So Manuka's Corps,
Yes, sir.
do they no longer have anyone there for registration and so forth? I thought I read something that.
So the Corps still has rangers and a manager.
They do have a manager?
Yeah,
Okay.
they still have a what I would call a manager. He manages the park, and then they have 2 rangers and a couple maintenance men, and then they have a guy named Matt Saylor who is over both Canopolis and Wilson projects.
Okay, so because I'd read something early in the spring that they weren't going to have maybe even closing Manuka, but that never happened.
They never
That
closed
was
Manuka,
federal.
but I don't, like I said, I
read that. I
don't
just
deal
wanted-
in their business very often.
Yeah, and I haven't been there this year, so I didn't know, and that's why I just wanted to ask if they do have it open. Thank you.
Yeah, I've been over there once for an emergency, so.
Here's a question. What is the current fees, the camping fees?
Camping fees?
Yeah.
So camping fees right now are $9 to camp, and then there's a transaction fee, and then a $5 vehicle permit to come into the campground, and then you will pay for electric, water, and sewer depending on what utility you have.
So generally for a weekend, what would?
Anywhere between $17.50 and $27.
All right. All right.
I mean, give or take.
All right. Thank you. Representative Williams.
Thank you, Mr. Chair. So, I mean, this looks like a pretty big issue for the local community. Have you reached out, or has anyone reached out to our congressional delegation? Is that a good step to, I mean, we've got a 30-day process for them to review the comments. And I just am thinking there's got to be some kind of user agreement. Table Rock has tons of docks everywhere. I can't imagine them trying to over-regulate. Certainly, there could be permits for houseboats that are pulled up, and I'm just wondering if any solutions were proposed within this, within the comment period, and if we should be seeking some congressional help on it.
That would be something, I talked to the manager of Wilson this morning, and he basically told me any questions I have to direct them to the chief of operations in the Kansas City district of the Corps of Engineers, because I don't know those answers, because that's the Corps of Engineers, and I don't do anything with them other than lease the ground and then run my park. So I don't know, as far as working with them, that would be something that the public would have to do to work with them, or the private dock owners would have to work with them to get that taken care of.
Okay.
Did that answer your question, ma'am?
Good enough. Thank you, sir.
Thank you.
Senator Petty.
I'm just quickly looking through the material did you provide this for us?
That is the information that the Corps gave me to provide you guys.
So do you know, under Appendix C, under the shoreline use permit conditions, is that specific to Kansas, or is that just?
I'm going to say that's probably specific to Corps of Engineers rules. I can't answer on all of their paperwork, because like I said, I don't deal with their paperwork. I deal with Wildlife and Parks paperwork, and not theirs. So like when I got this just yesterday morning. So I've had a little bit of time to run through it, but not a ton.
So it looks like there's like number 14 and number 28 speak specifically to overnight.
Overnight shoring of a boat.
At a dock.
On a dock.
Yeah, and that's not allowed if you're staying on
at the dock.
the craft,
Right.
or the craft
on the
itself.
craft, yes.
Yeah. So I was just curious as to whether that was specific to us, to Kansas, or you think it's.
I would probably say that might, and I can't answer this, 100%, because like I said, I don't know all of their rules on shoring and where they stay, but I can't. I would say that would probably be through all of the Kansas City district at least. If this came out, this would probably have to go through the Kansas City district for the Corps of Engineers.
Thank you.
Any other further questions? All right. Seeing none.
Thank you,
for being
Mr. Chairman and committee, for your time.
All right, committee, now we're going to move on to the next item on the agenda, and that's going to be contract nursing. This might actually take a while. So I'd invite Scott Bruner, the Deputy Secretary of Hospitals and Facilities with the Kansas Department of Aging and Disability Services. Welcome to committee, Scott.
Thank you, Mr. Chairman, members of committee. I'm Scott Bruner. I'm the Deputy Secretary at ks for Hospitals and Facilities, and I was asked to give a few comments about contract staffing at our state hospitals. Had an opportunity to road test much of this information last week to a special committee on health that met over a couple of days to talk about the same issue, dig into a few more issues. Thank you. A few other items around training and workforce development. So I'm going to broadly hit the topic, and then certainly be available for questions as you have them. And you should have these slides in front of you as well on paper. Just to start, maybe for context that I think most of you have worked on state hospital budgets at some point in your careers. The topic that we're discussing today is our use of contracted labor to supplement our staffing, primarily in the area of nursing. So we have state employees that work at Larned and Osawatomie, and also at Parsons and here in Topeka at KNI that are registered nurses, licensed practical nurses, and then some classifications that are unique to the state that we call mental health disability techs, or MHDDs. You'll see that acronym in the slides. And we hire state employees. We have positions for that. But over the last several years, we've not been able to fill enough of those positions, and we've maintained our capacity for the number of patients that we serve, number of beds that are online. So to kind of fill the gap between what our staff can do in terms of providing care and the number of beds and patients that we have, we hire contractors to do that work, or we contract with agencies that provide us staffing. The costs for that have grown significantly over the last 4 years or so, particularly at Larned. So the slide that's in front of you now shows what you've added to the budget. The total spend, I'll show you here in just a couple of slides, but in terms of what the legislature and the governor have added to those two hospital budgets over the last several years. In 2025, you added $30 million to Larned's approved budget and $8 million to Osawatomie State Hospital's approved budgets, just for that contracted staffing. And again, it's for registered nurses, licensed practical nurses, and some direct care staff. You might think of them as certified nurse aides or other, well, our direct care patient workers. So that's what you've added. Again, the issue is around our vacancy rate at the hospitals in Larned and Osawatomie. This number's come down some, but campus-wide, all positions, they're about a third of the positions are vacant. A good number of those are in our direct care classifications, and that's what we need to operate the hospital and serve patients. Our turnover rate, so in terms of the number of employees that churn or that we lose, that number's gone down a little bit over the last couple of years, but it's still pretty high. So every employee that that goes on to some other role, we either have to backfill them with a hire or use an agency contract nurse to supplement that. For Bethel, over the last number of years, we've been showing kind of our trend. So the graph that goes back to 2021 through the middle of July of this year shows the number of vacancies at each hospital, and these are in those direct care classifications, mental health, disability, techs, nursing, and safety and security. The top line that's gray, if you can tell the colors apart, is for Larned State Hospital, then Osawatomie's next. The darker blue line is Parsons and K&I's, the lighter blue line. So in July, we had 250 vacant positions in those direct care roles that we need every day to keep the hospital open at Larned, and 116 at Osawatomie. We've tried to also reference back to when, during the pandemic, the governor and the legislature gave us some authority to do special differentials for 24/7 operated facilities that enhanced pay for vacancy rate, a few different factors. That's where that orange line is. We still had a little bit of growth in vacancies, but we've been trending down over time with some variation. This is that same information presented as a percentage of the number of positions that are available, and you can see the same kind of, for Parsons and K&I, it stayed pretty flat. Osawatomie's lost ground but has done better in the last few months. And then Larned, we had a higher peak, but we're on a little bit of a downhill trend for those vacancies. One thing that we prepared for the special committee last week, just for context, and I'll try to just highlight what's in front of you, and is what we need to operate the hospital in terms of staffing based on the patients that we have. So this slide is for Osawatomie, and I would be remiss. Last week I got to do this with my superintendent, so they could answer all the hard questions and that came from the committee, but I'm flying a little bit on my own today. But so for on the Osawatomie campus, we operate two separate standalone hospitals. One, Osawatomie State Hospital, serves primarily patients that are longer term, that have some competency related part of their diagnosis or their treatment plan. So there tend to be longer term patients and maybe have a little bit more medical acuity. But what this chart has is for each of the units that we have in B building and C building, what the patient acuity is like on the right-hand column, and then what the staffing ratio is for each of those units. So just for example, on building B1, or Unit B1, the day shift requires 2 RNs, an LPN or an LMHT, a licensed mental health technician, which is a nursing position that can pass medications and do a few other nursing tasks, and 5 MHTs, or those MHTD direct care positions. The night shift takes 2 RNs, an LPN, and then 1 less MHT. So if you take all of the positions that, or all the units that we have at capacity, that's how many positions we would need to be able to staff those units. And that's again on the OSH side. AAC, or the Adair Acute Care Unit, is our more acute unit. That's admitting patients that are ordered by the court for a care and treatment case, an involuntary stay primarily. We've got two units in the Biddle building, and those are each 30, or one's a 30-bed unit, one's a 13-bed unit. The 30-bed unit takes 3 RNs, an LPN, LMHT, and 5 MHTs during the day, and then 2 RNs. You can read the numbers. So that's what we need to maintain the capacity. We think that was helpful for the committee to look at last week, just to get a sense of where people are, how many, because we show you those aggregate numbers for the whole hospital, but this is where it gets to every day. The team is managing where there are patients, what's the acuity, how many people are on staff, and how many more nurses or other personnel do we need to bring on through the contract. For Larned, this is the same kind of information across all 3 of the programs. So on the Larned campus, there's the state security program, which is our forensic unit that serves criminal defendants who are ordered for competency treatment. This has just by shift for that program in total. So in total, the security program itself takes every day 6 RNs, 6 LPNs, and 52 MHGDs. Psychiatric services is the acute unit that's similar to what Adair Acute Care does on a typical day. That requires 12 RNs, 6 LPNs, and 76 MHGDs. The sexual predator treatment program, so individuals that are civilly committed to our care after they've completed their criminal sentence, that takes 9 RNs, 14 LPNs, and 109 MHGDs, and then that last box in the corner shows you the total. So on any given day on that campus, we need 27 nurses, registered nurses, 26 LPNs, or other credentialed licensed nursing positions, and around 250 MHGDs. So that's when every bed's full. Most beds are full all the time. That's the staffing ratio that we need on a typical day just to fill those beds. Things make that number vary. So if we have a patient that requires one-on-one observation, so because they have a high suicidal risk, or they're violent, or have something else that indicates they need to be observed all the time, that adds 1 more person we have to put on the unit to just sit with that patient, times 3 at Larned, because there's 3 shifts. So that adds to this number. If the mix on the unit is a little more, with the patients don't need one-on-one, but there's a little more aggression going on that day, we increase the number of staff to take care of that. If there are patients that are being transported off campus for some medical reason or something else, we can vary the number there too. But that, again, just gives you the number, the idea of how many patients we're serving and what that minimum staffing level takes. This is the total staffing, or total spend, for contract staffing over the last few years. At Larned last fiscal year, at the end of the fiscal year, we spent a total of $46,046,250 or so for somewhere around 232 contract staffers every month. In that fiscal year. At Osawatomie, the amount was almost $15.4 million for 105. Larned's managed to keep their number. It did go up a little bit based on the acuity. Osawatomie's been able to, based on their hiring level and some other management mechanisms we'll talk about in a minute, we're able to bring their contract staff spend down year over year from 24 to 25. We did want to talk about some of the things that we're doing and tools that we have to help manage those costs, because they are striking. The costs are striking. The number of people that it takes is pretty striking too. To have 232 additional contract staff on the Larned campus, for example, that's more than half of the total number of people we need that work on that campus any given day. So one tool that we have that you provided in the last fiscal year was a proviso that lets us have some additional bonus authority so that we could give state employees special recognition and additional payments around recruiting, retention, and hiring of state staff. There are a few limits. One, that proviso raised the total dollar cap for each employee from $3,500 in a year to $10,000 in a year, and it did direct us to use funding. We had to use our own funding or savings within the budget to pay for those bonuses, and they had to be in those areas of either recruiting, retention, or hiring. So we used all of those over the course of the year. And this chart shows you for each hospital the total amount that we spent. This is probably a good place to just talk about the types of bonuses that we had, working from right to left. We had retention bonuses, so if were a current state employee in good standing and you weren't eligible for other kinds of longevity payments, we did a retention bonus for each employee across the system that cost about $2.9 million. Was really important to recognize some employees on the campus who the money that you'd already put in, an authorization you gave us to reward and incentivize employees that work 24/7, but on the shift side where they work hourly, we did a lot of things around pickup shift bonuses and shift differentials, things like that. But our salaried employees that are therapists, clinicians, administrative staff, they weren't eligible for those things because they're primarily salaried. So we got a lot of comments from employees that they really appreciated being recognized or having that bonus available to recognize the work that they'd put in to keep the hospital open and operating over the last number of years. Signing bonus, so if you're a new employee and you're hired under while this was in effect, we could provide a bonus for for becoming a state employee and staying on. It was awarded over 2 time periods at 6 months and 12 months. Because those are the 2 time points as we looked at the data. If we can, we lost a lot of employees that were hired after 6 months of employment. So if we could get them past that point with a bonus and we could keep them to a year, they'd be more likely to stay. 12 months was the other point. So we did that twice. There were some longevity bonuses as well for people that were long-term state employees. And the one that really we think made a big difference in just the operations of the hospital was pickup shifts. So the superintendent could identify particular shifts during the day or during the week that were going to be hard to fill. Either they were particularly short, sometimes it was weather related, and they could identify that shift that if you were willing to come in and work that in addition to your normal shift as overtime, we'd pay you $100 for that pickup shift, or if you could only do half of it or a part of it, you could get $50. That was really a good way for us to identify where the critical needs were, give the opportunity to a state employee to pick up that overtime, which they may have done anyway, but it helped us kind of target that overtime to shifts where it was really needed and we were really at risk of being short, and then kind of drive that incentive to have employees work the right shifts. All of these things required employees to be at work, so that if they didn't work that day, they were on sick leave or some other kind of administrative leave, they weren't eligible for any of these bonuses. But so we think that those impacted our ability to hire. More importantly, it impacted our ability for people to stay or retain employees over time as we looked at through that fiscal year. One example that the Osawatomie team provided last week, which I think is kind of important, this graph shows the weekly spend on agency labor, again, nursing, registered nurses, LPNs, and direct care staff. The weekly spend, by week over the last fiscal year, and you can see it's on a downward slope. At the beginning, or in 2024, fiscal year 2024, the weekly average of spending was about $355,000. Since the bonuses were implemented in July of 2024, the weekly amount went down to $282,000. And then for the latter, most of the last half of fiscal 2025, it was around $250,000 a week. They've had some acuity differences in the recent past, but overall the trend is lower. So at least at Osawatomie, we think that's a direct impact of bonuses, a direct impact of those pickup shift incentives as well. Larned also has some good things, compliments to share around the recruitment and retention benefits for the sign-on bonus, referral bonuses at the beginning of fiscal year 2025. This number alone, it really excited the superintendent enough that she has talked about it a couple of times and really wants to raise it. It won't seem like a lot, but I shouldn't downplay it so much without getting it all the way out. But so at the beginning of 2025, there were 132 state employees that were in that direct care MHGD classification. By the end of 2025, we had 188 employees in that classification. So we gained more than 50 state staff in that one classification. That's the not quite the lowest wage, but pretty low wage direct care entry-level position. And then we added 50 state employees over that year because of bonuses, because of other kind of wage changes that we've made. It's a huge change in our culture and how things operate. And again, we think it's a good indication of doing some of the right things around management. Now that 50, we're still 200 people short, but growing 50 over the course of a year, we think is a really good place to start. There was some other growth in other employee classifications and position classifications at the same time, and our retention rate was around 75%, which there are a couple things that people at Larned will say they haven't seen in their careers. A retention rate of 75% is one of them. Adding 50 state employees in that classification was another one. So again, I think that's some indication we're doing some of the right things to turn the corner on what we're spending for contract labor. I did want to talk a little bit about workforce development. Money's important. Paying people an adequate wage is important. You've made a lot of, helped us with that over the last several fiscal years. And then funding the contract labor also helps us kind of manage the hospitals, but we know we need to target developing the workforce and adding more people. So we wanted to highlight a couple of things that we're working on with that. We've used ARPA funds just from KDADS that you all authorized us to grant on a couple of things that are specific to the behavioral health workforce. We provided a $5 million grant to Kansas Health Sciences University, that's the osteopath school in Wichita, that added students to about 100 students to their first student class 2 years ago. They're not all behavioral health. There are some of those DOs that will go into behavioral health, but many of them are focused on rural medicine or frontier medicine and primary care medicine. So that first class of residents are going to graduate next spring. So we think that's a direct impact on the healthcare workforce. And a lot of those students are going to stay in Kansas where they trained. The biomedical campus in Wichita as well. There's several different ARPA awards. We had $15 million to complete that project. That's also going to address workforce issues around primary care medicine, social work, psychology, psychiatry, several of the areas that we need to focus on as well. A few more behavioral health specific, KBC, Camber, Children's Mercy built a new building in Olathe. We used $12 million of ARPA money to help fund that 72-bed facility. That helps with capacity in the system. We're funding an expansion of the emergency department at Via Christi St. Joe in Wichita. That's also going to help with, it's not long-term beds, it's not acute beds, but what happens at Via Christi St. Joe in Wichita is many rural hospitals or critical access hospitals that get a patient that's in a mental health crisis, they get to Via Christi St. Joe. They screen them, they can place some of them and treat some of them. They're one of our state institutional alternative partners, so they do some direct hands-on work that's at our level of acuity, and then some of those patients then go on to osawatomie as well. That's through their existing emergency department, which serves all kinds of people that have all kinds of conditions. This expansion is going to help target and make the environment more suitable for those patients and also to serve people with mental illness. So we're excited about that. And then finally, just in terms of capacity, we're adding the South Central Regional Mental Health Hospital that we're building in partnership with Sedgwick County. That's 104 beds. Also means that we have to figure out how to staff it, which is why we need to do things to build the workforce. At the hospital specifically, we're working, and we can bring you more examples of this from each of the campuses, but since COVID has largely not been happening on our campuses, we've re-engaged schools, we've got psychology interns, we've got social work interns, we've got nursing practicums happening on both the Larned and Osawatomie campuses. Having students in that practical environment, seeing the work that we do, working with our patients and our staff, has had a real impact on the mix, the kind of the training environment for our team. At Osawatomie alone, I think they had 7 student nurses that did their clinicals on campus, and they hired 5 of them to come work with us full time. So again, those kinds of being open to those opportunities and being an educational site is important, and we're doing that at both Larned and Osawatomie. Larned's also to try to grow our own and build our own, working with Barton County Community College to develop some micro credentials, focus on some specific skills and educational parts of mental health training for our staff so they can earn some college credit, add to their skill set, learn more about trauma-informed care, learn more about psychopharmacology, a few other kinds of specific discipline-related courses that are designed around an evening or a couple evenings a week and to earn some college credit and then decide maybe they want to go on and be a registered nurse and work in psychiatric medicine, or maybe they want to be an LPN, or maybe become a social worker. But as a way to kind of, again, build our own and provide a more rich training environment. People work really hard, so having something to look forward to that either is developing their career or adding to their skill set is an important part of what we're doing to recruit and retain. The Kansas Behavioral Health Center of Excellence is another initiative that KDADS is funding, working with the Community Mental Health Center Association, several of the schools primarily in the South Central region, and the University of Kansas to expand nursing programs, nursing faculty, forensic psychology practicum programs, psychiatric residency slots, just a number of different initiatives that are specifically around adding to the number of students that are training to become behavioral health professionals over time. Here's a little bit more about the biomedical campus and sort of how we think it fits into the behavioral health world as well. And then the last item I just wanted to mention is Kansas is participating along with 5 other states in a policy academy that's sponsored by a national organization that's really working. The team makes up of KDADS, folks from the BSRB and the Board of Regents to, again, think about how do we structure the training programs that we have to really produce people that want to work in these kinds of settings across the continuum of care. So a lot of different activities, going on. Because we were asked last week about some recommendations or coming up with other solutions for the cost of contract staffing and recruiting, we did put some effort into that. I don't know if you want to go into that, Mr. Chairman, or not, but I'll maybe just tell you what's in front of you, and then we can answer questions from there. We did try to figure out what if we didn't have any contract labor on the campuses at all, which I don't think it's not the practical question. It's, do we need to be as dependent on contract labor as we are? We're always going to need, in healthcare settings, the ability to float and flex and have some folks that work on contract. But if we're not as dependent as we are today, particularly at Osawatomie and Adair Acute Care, if we didn't have any contract labor, we'd be down to one 30-bed unit on the less acute side and only the 13-bed unit on the acute side. That's at least a 30-bed reduction in our acute capacity, which is when we're working today with a 25 to 35 person wait list, would have a huge impact on the system of care across the state. For Larned, it's kind of in the same ballpark. We'd be down either one program or needing to close one unit of each program. There'd be some problems doing that on the state security side, sexual predator treatment side. So it would have major impact on the kind of care that we can provide and the volume of care that we can provide around to folks in the state. We just tried to list this out by the area as well. If we didn't have as many beds, wait times would be longer. We'd be thinking about tightening up some of the admissions criteria would be one way to achieve that, be less safe overall. Some patients would be pushed back to jails, which is already a problem that we're trying to address. So just lots of impact, not just on our hospitals or our communities that we work in, but across the service system in the state. We had a few recommendations that the Senate had a special committee that talked about this issue last session. the special committee last week as well. We do think there are a few things that are pretty straightforward. The bonuses, again, the evidence is new, but we think it's pointing in the right direction to keep that in place and put it in statute. That there's a House bill on the Senate side that would memorialize those changes that are in proviso now in statute. We think keeping up with cost of living and market adjustments is an important thing to keep in mind as well. Again, the governor, the legislature have been very generous with our employees, particularly at these direct care positions, and keeping up, adding to their pay rates, embodying some of those 24/7 pay plan incentives in the base pay. But we're in a market where sometimes we're driving it, sometimes we're chasing it. But as healthcare costs go up, it's more expensive to have these employees. Our folks can move around to other healthcare settings as well. So just keeping up with the market, we think is important, and a commitment to that help us not lose ground. Just because I felt like I had to say we'd appreciate funding our request for contract staffing, knowing that there's risk with that and problems with that, but at least giving that some thought. And then some other things around workforce that we think are specific to our settings are to work on incentives to bring people into these job types. So tuition reimbursement or scholarships that's maybe tied to working in a state hospital would be something to think about, or service commitment agreements. Some things around either our current employees or employees that are going, or staff individuals that are going into nursing as a way to reimburse them for their tuition or student loan costs, particularly if they go into psychiatric medicine or a medical field that would benefit state hospitals. And then the last one is one of the things that we need to develop is more of a pipeline for nurses that want to add to their skill and gain a psychiatric specialization or forensic pharmacology or medical pharmacology, those kinds of additional skills. Those are great things for nurses to build their skills, to move into being nursing faculty or more advanced practice. And we use a lot of advanced practice nursing as well on our campuses, so funding those kind of pathways to grow our nurses into higher levels of licensure, we think would be an important step as well for recruitment and for retention. So just a few ideas for your consideration as well. Contract, it's a big issue. I feel bad putting the numbers in front of you, but I can tell you our request for this coming fiscal year that we're putting together for the governor's budget is numbers that are similar. Osawatomie's is lower, but Larned's is a similar kind of number to keep the beds open, keep our capacity where it is. And again, we're making progress on filling positions, but it's going to take us some more time, I think, to get to a different position to really reduce the amount that we're asking for contract labor in the next fiscal year, maybe fiscal year and a half. But I appreciate the opportunity to talk to the committee about it and answer your questions.
All right, thank you, Scott. So the first, I guess maybe not directly a question, maybe it's more of a comment. Because I know there's been discussions when we had, discussed the nursing shortage with the state hospitals across the state and appropriations. And even with the new facility being constructed right now and open in 2027 of 104 beds in South Central Kansas, the capacity is going to fill that hospital fairly quickly, correct? I mean, you can't shift patients from one facility to the one that's being constructed in South Central to try to alleviate the nursing issue in one particular hospital, because there's a demand in South Central Kansas for that hospital to be built there.
I agree with that. Just most of the folks or the regions that our South Central Hospital is going to serve are currently in the Osawatomie catchment area. So Osawatomie's, again, operating on a 25 to 35 person wait list every day, and has for the last 4 months at least. And so if we opening Wichita, we'll pull some part of that wait list off and some of the patients that would otherwise go to Osawatomie, but it doesn't do a whole lot for Larned in just where the catchment area is drawn. But it will have an impact on Osawatomie, but we'll fill all those beds with other patients from Johnson County, Wyandotte County, Douglas, Shawnee. So it's the right place to build the hospital. Totally committed to the idea, but I agree with you, we're gonna fill it up.
Plus, there's a demand in South Central Kansas, around the Wichita area.
And there's a demand in the area, absolutely.
That's the reason why that hospital is being built, not to shift the patient population. So let's talk about, well, obviously we're talking about contract nursing. So what is the anticipation of having contract nurses at that facility when it opens in 2027? Because right now, the only hospital that does not utilize contract staffing is Parsons.
Parsons, that's correct.
So I think there's an anticipation that if we don't change anything, that we're going to utilize contract nursing in the facility in the South Central Kansas.
There will be some contract labor. I would anticipate that we'll use some contract nursing. I think we're going to work really hard to recruit state staff. What I hope is, and I'm optimistic, that we're not going to be as dependent on contract labor as we are at Larned and to a lesser degree Osawatomie. But my anticipation would not be that we're going to open the doors the first day and have half of the staff be contractors. That's not where we want to be. That's not where we want to start. Will we have some float pool nurses or overnight nurses that are contractors, because those are harder shifts to fill? Probably, but I would not feel like I did my job right if I opened the doors on the first day and the majority of the staff are contracted labor.
So in anticipation of that new facility opening in 2027, and also to alleviate some of the issues that we have in the current staffing issues with the other state hospitals, where is that point? Where's that pay grade between able to hire on an hourly rate as opposed to contract nursing rate? And I've had a discussion about this with the superintendent of Larned State Hospital, so I already know the dollar amount, but I just wanted to have you publicly say where that spot would be.
So I can provide this to the committee. Got the same question last week. So our average at Larned State Hospital for our current staff is around $47 an hour for a registered nurse. We start right around $40, $41 an hour with a couple of dollars of differential. The state's market study says that's the right amount, or that's actually over the market for registered nurses. State market study doesn't take into account acuity or the type of hospital, just looks at nursing. So I think in the $42 to $45 an hour, we're competitive. In Wichita, I don't know that it might need to be a little bit higher than that given the marketplace, but I think as the superintendents have talked to some contractor staff that have come to be state employees, and then just in talking to the agency workers, what would you need to not be on contract or not work with a contract agency and come to work for us? They talk about $50 to $55 an hour. Right. And maybe some things around benefits and time off, some other, we do think there are some elements of, the state's benefit package is pretty generous, except in terms of accrual of leave and maybe the retirement plan, but the health benefits are pretty good by comparison. So, maybe some flexibility in in paid time off, and might make some difference as well that would offset some, of wage. But I think we're in the $45 to $50 an hour is where, and I think that's the target, given again the way we've collected that information by asking people what they would need. Yeah. I think that's what Superintendent Tops told you too, but I can look at my.
Actually, the figure was a little bit higher than $55 an hour, but
for Larned, it could be a little higher too for the rural nature of it too.
All right, I'll go ahead. Representative Williams.
Sure. Thank you, Mr. Chair. I may have missed it in here, but I remember a legislative post audit that said that 50% of, our labor costs for contract nursing. Right. So you may have mentioned that. I didn't see it in here. And if that number is still the number, did it go up, down? What percentage did it go up or down with all of the incentives that were added? You said we're moving in the right direction, but we didn't get any specifics.
I apologize for that. I'll pull that slide out. We did have it for the committee last week, and I'll get that back to you. But at Larned, at Osawatomie, for the first time in the last 3 years, there are more state employees on the campus than agency. But it's like 65% state staff and 35% contract. At Larned, it's still about 50/50, with a little higher on the agency side. We have an average of, I have to do the, 38, about 250 contract staff in those RN, LPN, and direct care positions, and around 175 state staff on a typical day.
So I think, I don't know if that slide would just summarize all of it, but having all of those state hospitals on one graph that shows what's happened over the last 2-3 years and contract and the percentage up and down. I thought, and those on appropriations can correct me if I'm wrong, I thought that the number that it costs for contract nursing was around $95 an hour, and that they were getting 3/4 of that. Is that not right?
It's close. At Larned, the maximum that we'll pay is $90 an hour. And then we think the nurses, that the staffing agency's getting $90 an hour. We think the nurses are getting somewhere around $65 an hour in their wage.
Okay, so just real quick, for the math, if we pay $40 to $41 an hour, you also add in your benefits, what is that hourly? When you count capers as well as the health benefits, what is that? Because they're not, those contract nurses, I'm assuming, wouldn't be eligible for any of those benefits.
They're not, they would as state employees, they're not eligible for them as.
Right,
on the
contract. So
yeah.
what is that total cost per, if it's for those nurses? Can you do it an hourly based on benefits? Because I'm just trying to understand, there's a huge potential savings between the $90 that we're spending and just giving everyone a raise and making sure that, there's some kind of requirement there.
So for Larned, the average hourly for an RN is $44.71. Again, that's what we think where we'd fill on average, and that hourly expense for benefits is $17.18. It's about 36%. So that'd be a total of $61.89 would be our all-in cost for a state employee as an RN in that scenario with our fringe, with our general fringe rate of 36%. So $61.89.
And so, of course, you've run all the numbers to find out, okay, if we move everybody over and we eliminate contract nursing because we give this offer, they take it, where does that leave us?
I think for Larned, it'd be about $31 million, and for Osawatomie, it'd be almost $16 million. That would be to fill all the positions that we would need at the average rate. I'm sorry, that's just base pay. We'd have to add the fringe into that too, but.
I think if those were already provided, that's great. If they weren't already provided, I think that would be helpful for us to see it and just be able to see that cost benefit. Sure. Because right now it looks like it's around $61 million total. I know we added 30 and you said 8, but I just think understanding those options, because we can't keep doing this. You also provided in here suggestions or solutions, and the assumption was if we didn't have contract nursing, we would have to close down certain areas, and I don't think anybody's suggesting that. I think we're looking for alternatives, which you are as well. Was one of the alternatives that I saw that wasn't included, and I wanted to ask you about that, would be the nursing scholarships. I don't know how many nursing scholarships and how much money the state spends annually. Perhaps KLRD could provide that number, but that would be another potential solution that would prohibit those nursing scholarship recipients to go into contract nursing for a period of 4 years until they had fulfilled, their benefit, let's say.
Service requirement.
And so I would be curious from KLRD, we had that as a proviso at one time. I don't know that it ever made it the long haul. So I guess I would just ask that question. Did it make the long haul? And okay, no, it didn't make the long haul. And number two, how much do we spend in the state of Kansas on scholarships? And the sad thing is we spend these dollars on scholarships, and if they're not going out to rural Kansas or they're not going to these highly in need areas, then we're probably not benefiting. I mean, they're probably going to be nurses anyway, is what I would say. If anybody has that figure, it'd be great.
Representative Carpenter.
Thank you, Mr. Chair. Representative Williams, those are great questions. We probably asked every damn question you could think of the other day, and we're gathering information, as this, but a lot of times we ask there was more questions opened up than there were answers. But we've asked for tons of that information that you just asked for to try to, and one of the things that it kind of struck me as we had folks testifying, when we start messing with the hourly rate of nurses, for instance, it also affects hospitals and everybody else. It's not just, we raised it to $60, so the hospitals are going to raise theirs to $60. You know what I mean? It's kind of a dog eat dog because there's just so many nurses that are out there, and the market is like that. So it's not as simple as, which makes sense. We need to raise ours to $60. Well, then all of a sudden we're still competing with the same people that we're competing now. So it's very complicated is all I'm saying. It's not as simple as just raising prices, because we had people talking about that same thing. But we do need to grow our own. That's one of the things that I think came out of this is scholarships that are geared towards working in the state hospital for a period of time and that kind of stuff. So we are working on that. One of the interesting things, and Scott's working on this and the Hospital Association, but I think overall, if you think about what it is, Larned, the staff that we can hire, not contract staff, has been pretty stagnant. And so what we need to do is we've got to shrink the number of people that are in Larned down to what the staff can handle. So that's the $2 question, that's the overarching question. I don't believe, quite frankly, that the new state hospital will be full. I think we'll be able to take some folks out of that new state hospital or out of Larned to that new state hospital. But one of the things that came up out of this thing, and it seems pretty simple, or maybe not simple, but it could be doable, is that we task some of our smaller community hospitals with putting in mental health wings. We've got a lot of hospitals in these rural areas that have empty beds. It's going to require an investment because we're going to have to bring those up to mental health standards, no ligature, none of that kind of stuff. But with, say, a $20 million investment, we're looking at, and one of the things we don't have the numbers back, but this is $46 million this year. If you start progressing this, and we've asked for this, it's going to be more each year. So it's probably 50 million next. You know what I'm saying? It's an ongoing trajectory. So if we took 20 million and did investments in these small rural hospitals that had a whole different labor pool that could staff these with some training, I mean, it's going to be an investment, but if we could invest enough that we'd save $20 million a year, that's not chicken feed, and it stops the trajectory. So those are many of the things I've asked. Everybody was overseas, but I've asked for another day of LLC. I will as soon as everybody gets back. We have a meeting on the 1st, and I've asked for the 2nd to try to compile all the information that we got the first 2 days, which were just literally mind-blowing. I mean, people's eyes were glazed over. But anyway, we're working on it. But we're thinking outside the box, inside the box, upside down. I told the committee, there's no option to do nothing. We got to get something on the books to do this and stop this trajectory. So, yeah, some great ideas. We're looking at all those. And a lot of them are going to require some investment, in the nursing. We don't know how many nursing programs they are, and we ask for that, and how many scholarships. So anyway, long story short, we're on it, and I'm hoping we get some really concrete things. But I'm excited about the last one that I talked about with the small rural hospitals. I'm excited about that because I think that it could be the savior. We pay now for state alternative institution. We pay about $1,200 a day or so, to house these folks on a volunteer basis. So there could be a pretty good revenue stream for some of these small hospitals that are struggling to house these folks if they get the proper training and all that. So anyway, enough from that.
Any other questions? Senator Petty.
Scott, as always, congratulations on how fast you can talk and keep going over all these issues. Very good.
Not the goal, Senator, but thanks.
On the bonus pay piece, I just quickly, it looks like you spent about 5.4, almost $5.5 million on whether it was in all these endeavors. And so when it comes to that investment as opposed to contract nursing, have you been able to look at how this amount, how much it saves us if you do this type of paying to keep people? And I was very much impressed with the figure of growing at the MHDD level, because like you said, that is entry level. It seems to me when I looked at that, when growing from 132 to 188, that means particularly that's drawing from that community, and that means that this type of job looks to be community people who have entry level or have the entry level skills to come in are saying, this is a job that pays me as well as working at McDonald's or someplace else. Would that be correct on that part?
There isn't a McDonald's in Larned, but yes. I mean, they could work somewhere else, and some are folks that have returned that went to work somewhere else and come back at that wage level. Senator, it's a great question. We need to do more work on to quantify where the bonuses went and how that impacted. I do think it is directly related to the number of MHDDs that we were able to hire. And I'm a numbers person, so that's what I want to see. I've heard more of the stories and going to Larned and Osawatomie about what impact this has had. The pickup shifts in particular, letting people, as opposed to, for those of you that have worked on our budgets in the past, we talk about mandates. So when we're short, we require people to stay over onto the next shift. That's extremely demoralizing to people to not have control of their lives and work-life balance. The pickup shift alone at Larned has really reduced the number of mandates that we've had to do to a historically low level for the leadership team. That means people are, they're choosing when they work and when they don't. They're choosing if they're available to work overtime, they can pick that shift up at their best judgment. That makes it a much more satisfying place to work. You feel like you've got some control over your life, and that because the superintendents are designating when those shifts are, when the high priority ones are, it's aligned with agency needs and the hospital's needs. So I think people feel much more focused on they're being used. I don't know that it's strategic, but they're being used in a way that serves the larger mission than just, we're desperate, you need to stay, or somebody called in, so you need to stay. So that element of choice and having some agency in the picking your shifts, I think is making a difference in some of those softer things that are harder to measure. But those softer things that are harder to measure is why people will go to Larned and work, stay at Larned and work, live in the community and decide to go to work at Larned instead of moving away or doing something different, seeing it as a career. So again, all things that we need to be doing, probably in addition to all the other things that you'll have recommendations to do or suggest, or that Representative Carpenter's really helped us think, again, outside the box. But those kind of cultural things. So these are the kind of investments that we think are helping with the work we're trying to do around culture and making the places better places to work and better for patients ultimately too.
Well, I know that employee bonuses, the expansion from 35 to 10,000, that's still right with us in the Senate Ways and Means. So that expanded information could be helpful for us as we look at this next year.
Thank you for that. Yes.
Representative Ballard.
Thank you, Mr. Chairman. I'm looking at the contract staffing usage, and I'm looking at the hours, and I have a question. Okay, first shift is 7 to 3 p.m. First shift, second 3 to 11. And I'm really familiar with that because my mom was a nurse, and 3 p.m. to 11 p.m., I know who had to fix dinner was me, you know, and so we look at that. But third shift is what I'm asking a question about, 11 p.m. to 7 p.m. Okay, so that's what, 19 hours?
Oh, it should probably be AM, 11 PM to 7 AM. Sorry for that.
Oh, okay. Because I kept looking at that and I thought, I've never heard of that one, and unless you have a split shift in the middle for people. But, okay, that makes sense. But that was where my question was when I looked at that, because I thought maybe that was something new
We
we were
don't require
trying.
people to work 19 hours. We have people who maybe try to work 19 hours, and we discourage them from doing that because it's
So I
not
was
healthy.
thinking, well, maybe you split it so that only half do something or something, because I see that you have like a total of 13 on that shift. Okay, so I don't have that question because I was a little worried about that. So you said your max that you'll pay is $90 an hour.
Yes, at Larned and Osawatomie.
What is the contract nursing? What does the agency charge?
$90 an hour. That's what we're paying to the agency for the RN's time.
That's 90, and
Yes.
then the staff person gets what you said?
Around 65.
Around 65. Okay.
With some variety, but it's in that ballpark.
Now, are they recruiting like Osawatomie? Would would they be recruiting, getting some of the nurses who maybe quit in order to go with them? And to make more of, I'm trying to figure out, where are they getting all of these nurses from? I know a lot are out of state, but where are all the nurses coming from?
A good chunk of them are from out of state. They're nurses who want to work on a traveling basis, so they'll come in and do a 12-week, 10-week rotation, and then move back to Louisiana or Texas and take a few weeks off and then do another 10-week rotation. So a good chunk of them are out of state. There are contract provisions that limit the agencies from we would call it poaching our staff. If they do hire one of our nurses away, they can't come back and work on our campus for a year. So there are some contract provisions, anti-poaching provisions in the contract. There's some the other way as well, so that we can try to recruit an agency nurse to come work for us. They've got to be completed with their contract, and so we try to be fair about it. But we are cognizant that we don't want it to become we don't want it to be a revolving door. We also don't want to lose people just because on wage alone. But no, I think that was your question. But there are some from out of state.
And
we've
you
seen
answered
that.
the other question
Yeah.
I didn't ask, is about is there a penalty if they decide to take from the staff? But you answered that as well. Thank you, Scott, and thank you, Mr. Chairman.
All right, are there any other further questions for Scott? All right, seeing none. Thank you for being here today, and we'll go ahead and move on to the next item, and that's going to be presented by Stephen Wu, the Managing Fiscal Analyst for Kansas Legislative Research Department, on a review of the 1.5% agency operations budget reduction. Stephen.
Good afternoon, committee. I'm just going to go through this memo real quick. It's a front and back summary of the 1.5% lapse for state operations. It's included in SB 125, the appropriations bill passed by this body, by the legislature. So this section includes the lapse of 1.5% for state operations. This includes both funds appropriated in that bill as well as funds that reappropriate from 25 to 26. For this section, state operations includes things like salaries and wages, contractual services, commodities, and capital outlay expenditures. What it doesn't include are capital improvements, debt service, aid to local units of government, and other assistance expenditures. In total, after these numbers have been certified, this impacts about, I think it's 24 agencies. They're listed in that table you'll find on this memo. Subsection D of Section 159, it also exempts a number of agencies from this lapse. You'll find the details of that in footnote 2. Notably, the legislative and judicial branches aren't included, as well as entities such as the Office of the Attorney General, KVI, Board of Regents and universities, and so on. So an update from when the legislature last met. The bill requires that the director of the budget certify these numbers in consultation with the director of legislative research. These certifications were done in June and earlier this month. The total amount certified to be lapsed is approximately $7.7 million. About $7.2 million of that is attributable to dollars appropriated in SB 125. The remaining about $550,000 is from funds that reappropriated from 25 to 26. So I've included a breakdown of what those numbers look like for each agency here. We're still in conversations with agencies as they prepare their budgets for this next budget cycle. So we're in conversations with agencies on, what areas those were cut from, how they've adapted to those, because agencies are deep in the budget preparation process. Those conversations have been ongoing. But you'll see from the table here, the majority of these lapses occur in 4 agencies. By about 70% of these occur in 4 agencies: DCF, KDADS, BIDS, and KDHE. The majority of it will be on the back page under the Human Services subsection. So with that, we'd be happy to answer any questions at a high level here. If you'd like for any specific details, I'd either defer to an agency response at a later date, or I'll defer to one of our analysts.
All right, thank you, Stephen. Representative Carpenter.
Thank you, Mr. Chairman. I really don't have any questions of Stephen. I just want to bring to your attention. So in the future, when we do this, we probably should designate where we want these cuts made. And so out of KDAD's budget, you'd take a 1.5% cut if you cut budgets 10% or something like that. But for instance, the Hope Ranch down in Wichita was cut $200,000, which is, they had a $300,000 budget. So that has devastated them. And you would think if you just cut everybody a 1% or a small amount, but when you're taking 60% of their budget, it's pretty significant. So I just want to complain about that.
Well, and I share that frustration too, because that was actually specifically line itemed as far as an allocation that we put in the budget. And for them to go and to cut that particular item that was specifically mentioned in the budget for a certain dollar amount, I think was disingenuous. I think it needs to come out of their overall budget, not something that's specifically mentioned in a budget. So we could clearly have language, and I think Jill will correct me if I'm wrong, that if we're not able to identify where to cut the funds, we could have language that said to have a reduction of said 1.5%, with the exception of items that are specifically mentioned in the budget. They are not to be subject to the 1.5% cut. Because I was a little dismayed by that as well. Any other further questions for Stephen? Representative Williams.
Thank you, Mr. Chair, and apologies if you already shared this, but when we look at this document, do we have a list of all the items that were cut for each agency? Like, for example, if I look at Kansas Department of Ag, it's 221,000, what are those lists? I know we've received some of those emails, but not all of those.
Yeah, so the lowest level of detail that we have is which SGF accounts they have been cut, but some of those don't neatly tie in with, specific project. So the lion's share of it for most agencies will be from their primary operating expenditures account, but some of them, like with the Hope Branch item, would be from a specific account for within that overall SGF fund. For those items, that's easy to identify. For those other items, like if it's in a general operating expenditures account, that is, we don't have complete information for that yet. We're still in conversations with agencies to determine on the ground what is different.
Yes, and okay, that's understandable. I would think that would be extremely helpful for us to be able to know exactly what was cut. From everything that I've seen so far, no personnel have been cut. And so that'd be another thing that I would be curious about, if any positions have been eliminated. So that would be just my request, is just to really understand exactly what was cut.
Sure, we can compile that information.
Thank you.
I think what I would add so far is, based on the responses I've seen as well, it matches with what you're describing.
Right, Thank you.
Any further questions for Stephen? And also, committee, I believe Dylan or staff is passing out 2 items in regards to the nursing programs with the Board of Regents and also with particular entities with universities in the state of Kansas. That's being passed out. Any more questions for Stephen? All right. See none, we'll go ahead and move on to the next item on the agenda, and that'll be by Dylan Deere, the Assistant Director of Fiscal Affairs for Kansas Legislative Research Department, and he's going to be going over the State General Fund reappropriations. Dylan.
Thank you very much, Mr. Chairman. So before I go into the actual presentation materials on the SGF reappropriations, I just want to take this opportunity to say thank you to Megan Leopold, whose last day will be next week. So I just want to thank her for her service to the state of Kansas, and I know she's been helpful to many people in this room, so I want to make that statement in public. Thank you for that opportunity. So the total SGF reappropriations, and this says preliminary state general fund reappropriations because we still are, making sure, dotting all the I's and crossing all the T's, making sure all the numbers are pretty close. I don't anticipate any major changes at this point, but I'll still have that little caveat. Totals $517.3 million. Is the total amount of SGF reappropriations. If you look at page 1, Adjutant General Disaster Relief is about $2.2 million. If you look at the Attorney General, we haven't passed that out yet. That's going to make more sense.
We got to ask, where's page 1?
We got page 1.
Give me a moment. So I'll go ahead and start, if it's all right with the committee. The way this is organized is just organized by agency name, SGF count, and we have requested a reason for the reappropriation or how it's going to be used from the agencies. In some cases, they're going to have that information now. We're going to know what that is. In other cases, we're not yet because the agencies are still putting their budgets together. Sometimes it's obvious, sometimes it's less so. So again, the Adjutant General Disaster Relief is about $2.2 million. It's pretty typical to have reappropriations inside disaster relief because of the time it takes for those funds to go out. If you look towards the bottom, you have Attorney General Safe and Secure Firearm Detection Program. That's the $10 million that was appropriated for that purpose. So those funds did carry forward. It was the intention for that to be possible. For bids under assigned council expenditures, it's $1.2 million. According to the Border Vigilance Defense Services, if you look at there's approximately $1.5 million in assigned council costs from June that were not processed until July, so it was a processing delay. Going to page 2. So the majority of these reappropriations here for Board of Regents are in scholarships. So we've tried to identify those scholarships where they're, in that line item under the name. If you look, there is also Blueprint for Literacy has a reappropriation of $6.2 million. Going to page 3. Department of Administration Docking State Office Building has a $5 million SGF reappropriation, and there's an $8.4 million reappropriation for the Senate Bill 66 licensing portal. There's underneath the Department of Commerce, there is a $34 million reappropriation for the MRO program. Apparently the contract was not signed by June 30th, but they did indicate that the project is now underway. There is a $31.8 million reappropriation for the evidence-based juvenile program. If you look at the Department of Education, the majority of these are your education caseload costs, and we're not going to have a good estimate on what those would be until we do the fall education caseload estimate. Looking at page, this is the amount that reappropriated, but what you can do with those. If you look at page 4, There's $1.6 million reappropriated for the unemployment insurance modernization program. There's $2 million that are reappropriated for the breast cancer screening program. And the third from the bottom under Department of Health and Environment, there's $11.8 million reappropriated for the HCBS FMAP projects. I would just remind the committee that this comes from the enhanced FMAP and has to be used on CMS-approved initiatives by federal regulation. Looking at page 5. Nothing I really need to, you got some reappropriations a little bit larger, but nothing super noteworthy. Looking at page 6, DCF operating expenditures, you have about $7.6 million of SGF reappropriations. The HC indicates this is for the Comprehensive Child Welfare Information System implementation. If you look at page 7, in the middle, you have Emporia State University. You have $2 million for the demolition of buildings. You'll see this demolition of buildings appear underneath a lot of the universities, and that's just because of the time it takes to get that demolitions done. There's $1.3 million in reappropriations for the ESU Cybersecurity Research Outreach Center, and there's $14 million in capital improvements for the Western Kansas Nursing Workforce Development Institute. And of course, Fort Hays State University indicates that just the capital improvement projects require planning, design, procurement, and timing. And so that's why anytime you see a capital improvement project, it's pretty common to see SGF reappropriations. Look at page 8. I won't bring up anything on that one. Look at on page 9. Once again, capital improvements, $9.7 million at Kansas State University. And $2.2 million, again, that capital improvements line, the second one, is demolition. And there's $1.6 million at Kansas State University for the Central Immersive Training Hub on the Salina campus. At the bottom, you have $70.1 million for regional beds. This fund reappropriated due to planned construction spending over multiple years for the South Central Regional Mental Health Hospital in Sedgwick County. So it says regional beds, but it's really construction is what we're looking at here. Looking at page 10. You have some caseload and some can-care and on-caseload costs. Under like the fourth item, you do have a reappropriation of $4.4 million related to the Mental Health Intervention Team pilot program. And it does mention that this was an approximately $1.7 million from KSDE as well as $4.5 million added during the 25 session, that the agency was unable to take on program responsibilities and expand in the first year of operation. The agency states that these funds will be used to explore options of a data system to track program outcomes. There's $3.6 million at KDEDS for long-term service supports, $2.6 million for reimbursements to counties and hospitals. Specifically, these are reimbursements for counties and hospitals holding individuals awaiting admission to a state hospital. There's about $1.7 million in funds for caseloads that is not can-care. It mentions it seems to include PACE. On 11, if you move down towards the bottom, there's $1.4 million at Pittsburgh State University related to the demolition of buildings and $3.2 million for the NEMA prove-out facility. At the bottom, again, another capital improvement project at page 12. $2 million for the American Center for Reading. Again, the capital project fundings were design and construction extended beyond one fiscal year. You have a capital renewal fund of $5.1 million at the University of Kansas for the Strong Hall chilled water, the Robinson Center re-roof, and construction of accessible routes and steam pipe replacement at Budick Hall. There's $6.5 million in capital improvements for the Wichita Biomedical Campus. And at the bottom, I'd like to bring your attention to the $72.6 million at the University of Kansas Medical Center, and this is part of the KUMC Cancer Research Facility. This is about 50% SGF, 50% ARPA, this project was. Looking at page 13, towards the middle of the page, Wichita State University Aviation Research, $2 million. So this is just, again, project timelines and lead time on equipment caused delays in purchasing of research equipment that was funded. And everything else is in that $1 to $2 million and is all capital improvement projects. So I know there was quite a few questions about SGF reappropriations last session, and so we just want to get these into your hands early this year so you can ask questions going forward in the future. Does anyone have any questions on these reappropriations?
Thank you, Don. Questions? Representative Ballard.
Thank you, Mr. Chair. On page 12, I'm sorry, I was reading and I missed it. But he said the University of Kansas Medicine is 50% ARPA and was it 50% SGF?
Yeah, it's 50% SGF, 50% ARPA. And that's that joint project between Wichita State University and KU Medical Center. So it's a joint project.
And the other one, I think for Wichita, you indicated that it said regional beds, but it was really construction.
It's right. The Central County Hospital is what that is. The fund says regional beds. That's what the SGF account is. That's where it was put. But it's really that Central Hospital.
Thank you.
Other questions? Seeing none? Oh, Representative Williams.
Thank you. Really quick. So I thought when we first were looking at this, it was SGF, but it sounds like this is a combination of SGF and all funds.
It is not. This is 100% SGF.
Okay.
I just mentioned that project.
Gotcha.
It's like funded from several different sources.
Excellent. Thank you.
Other questions? Seeing none? Thank you,
Thank you, Mr.
Darla.
Chairman.
Next, we'll have fiscal year 2025 final expenditures and revenues. Edward Penner, Assistant Director of Research for KLRD. Eddie, welcome committee.
Thank you, Mr. Vice Chairman and members of the committee. You should have 3 different documents in front of you from me, or you will in a very short order. I'll start describing them while they are passed out. One is the final SGF receipts memo for fiscal year 2025, which is what I'll primarily and initially be presenting from. The second is just the monthly update for July FY 2026, the monthly receipts memo. And then the third and final document is information related to Senate Bill 269 provisions, but it's BLS data for the Consumer Price Index that I'm going to speak from and talk about how the calculations are made pursuant to SB 269. So if everybody has the FY 25 year-end receipts, which is primarily what I'm going to speak from, I'll go ahead and get started with that. As you can see, the bottom line number, actual receipts for the fiscal year beat the estimate by $132.3 million or 1.3%. And jumping up, you can see that total taxes beat the estimate by $248.6 million or 2.5%. So I'll stop right there and explain the difference between those two numbers, or at least the single largest contributing factor to that difference. And that is the provision in law that provides for 50% of any excess tax receipts to be transferred to the Budget Stabilization Fund. When that takes effect, that kind of makes us as estimators look better than we actually are in terms of our accuracy. Because as a result of that, $124.3 million was transferred to the Budget Stabilization Fund that was not anticipated. So that is the difference between, or the bulk of the difference between the total tax margin of error versus the total receipt margin of error. That probably provides a good opportunity to answer what I'm sure is going to be a question that I would get if I don't answer it now, and that is, what is the balance in the Budget Stabilization Fund now that we've had that extra $125 million transferred there? As of August 15th, that balance was just a shade over $1.9 billion. I believe it was $1,907 million and change. And so obviously that's 124.3 million higher than we would have anticipated it would have been prior to the end of the fiscal year. But now back to receipts. You can see that by far the largest contributor to the excess receipts was individual income taxes, which was $225.7 million or 5.1% ahead of the estimate. The strength in individual income tax receipts came from all components that contribute to individual income tax receipts. Of course, that's withholding taxes, estimated tax payments, and then also the net of balance due payments and refunds. And so withholding taxes exceeded the prior year amount for the fourth quarter of fiscal 2025 by 6.3%, which is right around $65 million. The consensus group, while we don't estimate those components formally with any specificity, kind of as a group, we were expecting that to be more or less flat from year to year. It had been higher than that earlier in fiscal year 2025. In the third quarter, it had seemed to show some signs of maybe leveling off a little bit, and we were expecting that leveling trend to continue throughout the year, and it did not do so. Estimated taxes for the fourth quarter were actually slightly down relative to the prior year amounts. However, as a group, we were expecting those estimated taxes to drop by a meaningful amount in the fourth quarter because of the fact that during the fourth quarter of fiscal year 2024, the income tax still applied to Social Security payments, and of course our tax rates were higher, and there were other changes in the special session tax bill during the 2024 special session that also contributed to taxes being generally higher a year ago than they were this year. And so we expected that to drop off to show up in estimateds, and it did not do so. It did to a very small amount. I believe it was about $5 million total across the fourth quarter there. And then finally, balance due payments and refunds also held up well. With refunds being a little lower than we were anticipating, balance dues being a little stronger than we were anticipating. The big key to note there is that there were a certain chunk of refunds that were shifted, in essence, from fiscal year 2025 into fiscal year 2026. During last year's tax filing season, if you happened to be a taxpayer who received a refund, you might have noticed that it took a little longer for that refund to get back to you than it has perhaps in previous years. That is because of the mid-year tax change as a part of the special session tax bill. As a result of that, far more tax filers received refunds this year than historically do, and a lot of those taxpayers were taxpayers who historically had made a balance due payment, but this year they received a refund for the first time, at least in several years. When that happens, it results in a higher number of those refunds being work-listed by the Department of Revenue. In essence, those are the sorts of things that are fraud flags that the Department of Revenue takes a little bit closer look at those refunds to make sure they're accurate and appropriate, and not some sort of fraudulent activity where a nefarious actor is trying to maybe take advantage of a mid-year tax change and get a different taxpayer's refund or something like that. As a result of that increased work listing of refunds, it just kind of slowed down the entire refund system for individual income tax filing throughout the entirety of tax filing season. This started out all the way back in February, and the backlog associated with that is actually just being resolved right now by the Department of Revenue. They do think basically at the end of this month we'll be kind of more or less fully trued up with refunds for this tax year relative to where we ought to be in a normal year. It's difficult to say exactly how many dollars are associated with those refunds that in a normal year we would have paid out during fiscal year 2025, but this year it seems like we're paying out in fiscal year 2026 because obviously there's a lot of moving pieces that go into that. But there were a decent number of those refunds that were work listed and then got delayed because of that. And so that resulted in the FY 2025 receipts being a little higher than they would have been but for those refunds being pushed into FY 2026. And accordingly, it will result in FY 2026 receipts being a little lower than they otherwise would have been. But that issue is not the, the bulk of this $225 million. It's a meaningful contributor to it, but I don't want you to walk away from this presentation thinking that we didn't really beat the estimate last year. It's just because of that refund issue. We really did beat the estimate last year, but the refund issue made it look a little bit worse than it actually was. The only other thing that I do specifically want to note as it relates to the FY 2025 receipts are that sales and use taxes, you can see those beat the estimate by about $30.5 million or 0.9%. Usually something that's within 1% like that, I wouldn't call a special attention to, but in this case it is something that we had been very, very close to our sales and use tax receipts for quite a few months prior to the final quarter of FY 2025. And we have done a little bit of speculation in terms of, is it possible that that was consumers adjusting their behavior in that final quarter due to either perceived or anticipated or potentially real impacts of tariff policy? Specifically, are consumers kind of accelerating their purchases to try to get ahead of the effects that tariffs might have on consumer goods? And so that's why we think that might have happened. But obviously it's not a big dollar amount, and it would be difficult for us to ever say that with any sort of certainty. So that's really all I have to say on FY 2025 receipts. Obviously, it seems like we missed something as it relates to individual income taxes. Whether that miss is the actual growth in the economy, the way that that growth in the economy is translating into receipts, or just the effects of policy changes, since we did enact a pretty substantial income tax overhaul bill during the special session, it's really not possible for us to say at this point. I'm not sure that it will ever really be possible for us to say that with any specificity. But if it is, it will be probably at least a year down the line from now before we're able to say that with much certainty. But we're of course paying very close attention to that at this point, as we will be revising the FY 2026 estimate in November and issuing the first estimate for FY 2027 at that point as well. And so with that, I would happily stand for questions on FY 2025 receipts, or I can jump straight ahead to just a brief comment on the July 26 receipts.
Are there any questions? Representative Ballard.
Thank you, Mr. Chairman. Just a clarification question. You mentioned holding it up because of what they paid on ballots and the other. Does that reflect, will that be reflected in 25, or have you moved it to 26 with notation?
You mean the effects of the shifted refunds? Mm-hmm. No, so that we don't revise the estimates just because of we learn about new administrative effects of laws, administrative issues, so to speak, at the end of the fiscal year. So this reflects our actual estimates and the actual receipts for FY 2025. And so that $225 million that individual beat the estimate by, it would be maybe somewhere in the $30 to $50 million range lower if we had gotten those refunds paid out during FY 2025. And accordingly, our FY 2026 receipts will be somewhere in the $30 to $50 million range lower than they would have been if those refunds had actually been paid out in 2025.
And for those individuals, how long did they have to wait for their refund, since you had to look into their dilemmas?
Well, I think the key thing, and it varies a lot from individual to individual, how long the delay for refund is. The state starts to pay interest on those refunds after 2 months. And so anybody who didn't get their refund as of June 15th, they started accruing interest that the state had to pay as a part of that refund, assuming that they did file in a timely fashion and were appropriately entitled to the refund.
You answered my question. Thank you very much.
Representative Williams.
Thank you, Mr. Chair. And so my question is more about the actual receipts versus the estimates. Those were pretty good, spot on. So the difference in, if you look at 24 and 25, would be mostly just the lower inflation and also the tax cuts.
I
For
think the difference is probably entirely the tax cuts.
Tax cuts, not inflation,
yeah.
where we were bringing in
Because
more
keep
money.
in mind, we not only had the individual income tax cuts that were a part of the 2024 special session tax bill, but also food sales tax reductions were continuing to be implemented in that time frame. And so that also contributed to the reduction there on the sales tax.
Is that about $1
side.
billion a year?
The food piece?
No, all of, collective, all of our tax relief.
So it depends on exactly when you start toting it up and exactly what you fold into it. You know, as of, you would have to, in order to get to what the number is, you would have to say which year's bills you're trying to capture. And you can get to a very high number or a very low number depending upon exactly how you draw that. So I'd be happy to put together what the number is if you want to tell me, starting with this legislative session, tote up our tax legislation.
We have had estimates along that line, but I do think it would be even helpful, not the tax committee, but for us, I think that'd be great at some point having that, just so we can see it face to face. And then the quick last question is the corporate income tax. That is significantly less, and explanation on that. I didn't think that they received the much relief.
So the corporation income tax, there were some rate reduction kind of issues there, but part of that is just slowdown in the corporate economy or possibly particular strength in the corporate economy in fiscal year 2024. Because in at the beginning of tax year 2024, we did have a rate reduction for corporations that was attributable to the rate reduction associated with the Apex project. And so we saw about a half year of that impacting the fiscal year 2024 receipts. We did see a full year of that impacting the fiscal year 2025 receipts, since that went into effect January of 2024. Additionally, though, we have now seen Apex investment tax credits start to flow into these receipts. The agreement with Panasonic provided for those each years to be split out into kind of 5 pieces, and then to be paid over 5 years in equal pieces. And the first year, the first fifth of the first year of those did go out in fiscal year 2024 to also contribute to reduced receipts. But that's something that, in terms of a weight on corporation income taxes, that's going to grow over the next couple of fiscal years. It will then level off for about 3 years and then start to taper off.
Mr. Chair, that also would be something super helpful for our committee as we're putting together the budget, because I think there's also impact with obviously our economic development incentives, HPIP, that's $100 million a year, though that's been consistent for a time period, but just to really seeing what is impacting this, and do we have growth in our in terms of the number of employees that are employed by our corporations, or are we finding that we're just stabilized? And I guess bottom line, is the money that we are getting back, is there a return on investment of all the economic development incentives? So finding the breakdown would be amazing.
I would agree. Representative Carpenter.
Thank you, Mr. Chair. Edward, thanks for being here. So is 2024 going to be the last year that we're going to see the reduction in sales tax for food? So it's off the books now.
So it's off the books now, but fiscal year 2026, the year that we're currently in, is the first year where the full fiscal year will have no sales tax associated with food, and the full fiscal year will have the general fund, highway fund split at the 80-18. And so this year's net impact of that policy will be larger than last year's net impact of the policy. But at this point, as for taxpayers, there's no further reductions, and that's the last reduction was January 1 of last year.
Well, for someone that follows for the health of the economy, sales tax, because it's such a good barometer of whether people are spending money and taxes are almost paid. The last few years have been a nightmare because we've taken food sales tax off in chunks and this and that, and I'm ready to finally get down to where I can see if it's actually real sales, real growth, or just reduction in the food sales tax. So
as someone who kind of does the opposite, where trying to monitor the health of the economy and then translate that to an estimate for sales taxes, I can tell you that I have the same feeling that it's been difficult the last few years, and I'm looking forward to having a stable law from year to year to track growth with. Yeah.
Me too. Thank you. Thank you, Mr. Chairman.
Any other questions for Edward? I guess I have one question in regards to the gas severance tax.
Mm-hmm.
Was that just in 24, they just missed the estimate so much that in 25, the expectation was lowered?
Do you mean?
Well, in 24, it missed it by $1.6 million.
That's actually not what that means. What that actually means is that our gas severance SGF receipts in FY24 were negative $1.6 million.
Right. That's why, I just said that wrong.
The receipts themselves were what were negative, not the margin relative to the estimate.
Yeah, right.
Mm-hmm.
But I was just wondering, and then the estimate in 25 was 2.9, and then the actual in 25 was 3.4. Mm-hmm. I didn't know if there was something to do with production, or if it was just the percentage is 315%.
I'm trying to recall if there was anything specific that happened at that. With the severance taxes and the Mineral Production Education Fund receiving its fraction of the severance taxes based upon the prior year amounts, that any time that you see a big price swing up or down, and then the next year it renormalizes, it causes kind of weird things to happen as it relates to the severance taxes, which is how we got the negative 1.6 million in in FY 2024. It's not that we actually paid out more refunds in severance tax than we did receipts. It's that the SGF piece of it was negative because the Mineral Production Education Fund piece of it was more than the total gross receipts, since it's based upon the prior year's amounts. Right. And I think it's just kind of one of those rules of small numbers, actually. When you have 2 months where the entire MPEF piece of it goes out, it can make it difficult to track on a month-to-month basis, and that's probably where that miss came from.
Right. Thank you for the explanation. Mm-hmm. Any other questions for Edward before we move on to Dylan? All right, seeing none?
I actually have a couple other things I was going to mention briefly.
Go ahead.
The first of those is the July FY26. I just want to give you a brief heads up that through 1 month of this year, we are $16.2 million ahead of the estimates, and total taxes is $21.2 million ahead. Of course, we always want to be careful trying to project anything based upon a 1 month sample, so I would hate for you to walk out if you're saying, just multiply that by 12, and that's where we really are. But it is worth noting that individual income taxes have continued to be very strong, despite the fact that we had a high volume of refunds, a higher than usual volume of refunds go out in the month of July. But to continue on one of the points that Representative Williams made, the corporate income tax receipts were particularly weak in the month of July. One thing that happened with corporate receipts in the month of July is historically they had been a very small amount. Coming out of the pandemic, it seemed as though just a handful of corporations might have started making very large payments in July, because all of a sudden that month saw a bump in payments that was kind of inexplicable, and it didn't really track with other months. It does now. At this point, we're wondering if this means, are we returning to what the normal had been prior to 2020, fiscal year 21? And there's not really anything else to note here. Insurance premiums beating it by such a large amount was a one-time event related to a single taxpayer, and is not something that really projects on into the future. And then the only other thing that I did want to go over with, of course, during the most recent legislative session, the legislature passed SB 269, which provides for formulaic reductions to individual income tax corporation income tax and privilege tax rates based upon the amount that the receipts from those three taxes exceed inflation-adjusted base year amounts. And since this is something that over time will start to kind of impact the budget on an annual basis, and it's probably something that is beneficial for this committee to be briefed upon. And so you have in front of you a two-sided sheet, one of which is solid white, and the other one does have some blue and green color added to it. The solid white sheet of that I'm just going to mention briefly. This is just a printout of the not seasonally adjusted consumer price index for the last about 10 years. If you just run a simple report on the Bureau of Labor Statistics website, this is what you get. The other side, I've added some notes and annotations to describe to you how the SB 269 process kind of works there, because that bill defines very specific terms, and it can be helpful rather than just have the uncertainty of waiting until August 15th each year to find out, is there going to be a tax cut or not? We can actually look at this information on a month-to-month basis and see kind of how we're trending in terms of what our expectations should be regarding tax cuts under that bill in future years. And so the bill provides for the base year CPI to be the average of the not seasonally adjusted CPI for fiscal year 2024. And so you can see I've highlighted the relevant months for that in blue, and the average of those months down at the bottom is 309.57. It then provides for the fiscal year CPI to be the average of the same data for the immediately preceding fiscal year. So for fiscal year 2025, that's the numbers that are highlighted in green, and you can see it's 317.73. So that provides for a 2.6% growth from the first year to the next that is the inflation adjustment. And so the way the bill works is you take the base year revenues, which were and are written into the statute as being $5,969.4 million, multiply those by the 1.026, and then all those decimal points to get your inflation adjusted base year revenues. It's $6,126.8 million. And then you compare that to the actual FY 2025 receipts from those tax sources. And this year they happen to be $6,038.3 million. The difference there, if it is positive, is what yields a tax rate reduction in the following tax year. And so this year you can see that the difference was negative $88.5 million, which is The key number you need to know that since it's a negative number, there's not a scheduled rate reduction in the following year. That 88.5 million, in case you're wondering, translates to about 1.5% of the tax amount. And so in order for there to be kind of the break-even point next year where there would be a rate reduction the following year, the receipts from these tax sources need to beat inflation by about 1.5%. That's kind of the break-even point. If they beat inflation by more than about 1.5%, then we would see a rate reduction attributable to the provisions of that bill. If they are 1.5% more than inflation or less, then we wouldn't see a rate reduction attributable to the provisions of that bill. And so that's kind of the state of things as it relates to SB 269 right now. This is obviously something that our office is going to keep close tabs on kind of every time all the turning points in the budget and tax policy, so to speak.
All right, thank you, Edward. Senator Billinger.
Thank you. Just real quick, is SALT still affecting the corporate tax?
Yeah, the SALT Parity Act is still in the books. It doesn't have any expiration, and the cap on the SALT deduction was extended, although it was increased substantially in the federal, the OBBBA, the federal legislation this summer. And so, yeah, that provision is still in the books, and it's still kind of flowing through as normal. At this point, that seems to have more or less stabilized, though, within the taxes.
So that's not part of the reason that corporates are down?
No, I think that the decline there is not, it's not policy related. Now, are pass-throughs seeing a similar decline as C corporations? That they might be, but it's not a SALT issue that is causing that miss, no.
Mm-hmm. Representative Williams.
Thank you, Mr. Chair. So basically, if we are $88 million short for a scheduled reduction, then that means that any year that we add more incentives to the books, we get farther and further away from rate reductions, correct?
More incentives, but only to those three tax sources: individual income, corporation income, or financial institutions privilege. Any tax policy that serves to reduce the receipts attributable to those sources would make it more difficult for the rate reduction formula to kick in, and any tax policy that causes the receipts from those sources to increase would make it more likely that the rate reduction formula kicks in.
All right, thank you.
I guess I should mention on 269, there is a budget stabilization fund balance requirement associated with that. The budget stabilization fund balance has to equal or exceed 15% of the SGF tax receipts from the prior fiscal year. This year it did exceed that. I believe it was at about 19.1%. And so for the present, the budget stabilization fund balance is not a limiting factor to that.
All right, any further questions for Edward? All right, see none? Mm-hmm. Now we'll turn over to Dylan, who will give us an update on expenditures. Dylan.
Thank you, Mr. Chairman. I'll keep this short and sweet. I know it's the end of the day. You should have the SGF profile in front of you. I am covering the other side of this equation. So all we've done to the profile at this point is we've updated 2025 for actuals. So, this $10 billion was an increase of about $132 million, which is the FY 2025 numbers that Eddie just showed to you. And on line 11, we updated the actual expenditures to $10.3 billion, which is lower. We had about $10.6 billion was the original approved amount of expenditures for FY 2025. And then that was the amount for 2026. So what happens is the $517.3 million in SGF reappropriations carries forward. So I said 10.6, it's actually 10.8 was what was approved for FY 2025. And that carries forward in line 12, because whenever you have an SGF reappropriation, those reappropriations appear as approved expenditures in the following fiscal year. And if you continue to follow line 12 along, we reverse out that $517.3 million in approved expenditures. This profile does include projected human services caseload adjustments and one-time spends. So that negative $13 million that you're seeing in line 13 is based upon the April consensus caseload estimate, which has not yet been adopted by the legislature. And you will have another stab at that particular number as part of the fall consensus, human services consensus caseload estimate before you have to adopt anything with it. We did carry forward in line 13, assuming that we'd see continuous increases in human services caseloads of about 110, 115, $115 million, and in school finance of 100, 111.2, and 113.1 in each year, despite the fact that the school finance formula is expiring. And in line 15, you have one-time spends. So there's about $38.4 million in approved one-time spends in FY 2026. The actual number of approved one-time spends in 2026 are actually a lot higher, but the majority of them are part of that reappropriation number, so you can't double count them. But we would still back out about $38.4 million. So that leaves us in line 19 with an ending balance projected in 2025 of $2.9 billion, falling to $1.9 billion, $1 billion, $313.7 million, and negative $405.9 million. If you look at the line 23 at the bottom, receipts above or below expenditures, that means starting in 26, you have the negative $1.1 billion receipts are below projected expenditures, and then a continuous number somewhere in the $750 million range in each year thereafter, which does, of course, drive those numbers down. These balances do not include the balance of the Budget Stabilization Fund, which is reflected in line 21. So you still see that 1.9, 2 billion, 2.1 billion, 2.2 billion, $2.3 billion projected as the Budget Stabilization Fund would continue to be receiving its interest income, but that those projections do not include any extraordinary transfers from us beating the estimates. And with that, I would stand for questions. I would note this profile is draft pending final expenditure adjustments and released encumbrances. Those normally run between $20 and $40 million per year, so it's not usually a big number. But we will have a final version of this profile when we do our fall consensus revenue estimates and updates. And with that, I would stand for questions.
All right, thank you, Dylan. So you said it didn't, for the Budget Stabilization Fund, it does not account for any extraordinary transfers, obviously, because that's always the determination by the legislature. But does it account for a statutory transfer?
So there is the transfers into the Budget Stabilization Fund don't exist in permanent statutory law.
Oh, okay.
Okay. And so the way it has been receiving transfers is when we, like in this last year, when you beat the estimate, okay, half the amount that you beat the estimate from total taxes gets put into the Budget Stabilization Fund. Of course, we can't project that going forward. We're going to assume that we're going to get the estimate perfectly. You never will, but I mean, that's the way you build it. But it does receive its interest income. And David can correct me if I'm wrong, but I believe those extraordinary Budget Stabilization Fund transfers are suspended for FY 2026. No transfers. Yeah, we didn't have to suspend them because, once again, they're not even in statute. So we create them in the appropriations bill each year.
All right. All right. Committee, any questions for Dylan? Seeing none. All right. All right. I think I received everybody's vouchers, and I turned those in to Susan. So I think she will, or she already has turned them in. So she will. Okay. As of right now, we do not have a date selected yet for our September meeting. So I'll work with Dylan on trying to get some dates put together, but probably around the same time of the month as we had it in August. So until the next meeting, we are adjourned.